Let's test it again. Okay, can you all hear me? Fantastic. Well, good afternoon to all of you. We will start in a short bit. We're a tiny bit late, but you always know that when things are late, they turn out to be great. So we will do it this way. So how are you all doing? Let's see. Okay, it works, yeah. Are you all doing well, yeah? Everyone, yeah? I see so many familiar faces, some new. I see Susanna here. Thank you very much for being with us today. I'm really curious to hear your thoughts about this great initiative that is going to come soon. So really, really thankful for you to be here. I see other colleagues, so fantastic. We're waiting for a couple of more minutes, so if you want to go to grab a glass of water or quickly run to the loo, now it's the time to do it, because later on we will close those doors and no one will leave until proven otherwise.
Okay. Okay. Ivo, 1, 2.
Good. Not working. Not work. Working. Okay, now it's working. Can you hear me well? Yes. Fantastic. So, good afternoon, everyone, and a warm welcome to the EHP Final Plenary. Thank you very much to our distinguished speaker here with us today. My name is Alessandro Darold. I'm the Managing Director of EU40, which is one of the partners of the European Health Parliament. We come a long way. It's the 7th edition, so 7 years of all of us here together, trying to reshape the various conversation at European level. Let me see if maybe with this one we can. I think it's working. Okay, now it's working. Okay, let's see. So we are a tiny bit late, so I will be extremely short. So please let me thank all the people that worked behind the scenes for this event. A lot of people worked for it, so thank you very much. I see them around here. Thank you to all the partners that made the EHP possible this year once again. You will see them at the bottom of all our flyers. Thanks a lot to member of the European Parliament, Tomislav Sokol, who is not only a huge fan of the EHP, a champion of the EHP, but is also a member of the board of our EU40. So really, I always thank you for being part of our discussions. I will give him the floor for a few words of welcome, and then we will go to Zeger and to Eleonora for a few words of welcome, and then we will discuss the policy recommendations which are at the heart of this discussion today. So thank you very much. Finally, let me say, for everyone who's following us online, please put your Q&A, your questions on the live cast. They assure me that from the technical side everything is working fine, so you can all put your questions there and they will come to the speakers, as well as use the hashtag on Twitter, #ReinventHealth and EHP7. Thanks a lot once again, and Tomislav, the floor is yours.
Thank you, Alessandro. Thank you all, and I would like to especially thank all of the partners who are taking part in the organizations in another EHP. I'm also glad that I'm again one of the MEP who is hosting and who is, let's say, sponsoring the event. I think this is very important. When you speak of healthcare, healthcare is not a traditional focus of European Union institutions and European Union policies. It's usually been on the margins, partly because of lack of competences of the EU to actually do something, since you know that member states are primarily responsible for healthcare, but also because there was in most cases not lack of political will to actually do something and change things on European level related to healthcare. This has changed now because of COVID-19 and Europe's Beating Cancer Plan and European Health Union. We now have the momentum where actually healthcare is being discussed in the European institutions, but we should definitely seize this momentum, because already there's other topics which are taking hold, like especially war in Ukraine and some other things. So we are kind of losing this focus on healthcare that we've had in the last 2 years, and this is something that we should not allow. So we should use opportunities like this, like young professionals, young people who are actually proposing new and innovative health policies, to actually maintain the focus of the Parliament, but not just the Parliament, on healthcare as the crucial and one of the crucial topics of Europe today. So we are facing many challenges. COVID-19 has still not gone away. We see that numbers are going up, so we'll see what happens, especially during fall. Digitalization of healthcare, one of the big topics, and also sustainability of healthcare systems. European Health Data Space, which has been proposed about a month ago as a very important topic. So how to use data in a much better way than we've been able to use the data up until now. So both primary and secondary use of health data. We know that there is problem of the lack of interoperability, lack of common protocols and standards on how to use data from different member states. Also, there are big differences in terms of the standards of healthcare provision in different member states, in terms of health infrastructure, workforce. We know that especially eastern member states of the EU are facing the brain drain of health professionals, especially doctors and nurses, to western and northern parts of the EU. So these are all partly because of small salaries, but also working conditions which are suboptimal. So these are all challenges that we are facing now in the European Union, and these are challenges which member states cannot resolve by themselves. This is why I highlighted them, but we need common action on European level. So, and this is why we think it's important, and that's in accordance with principle of subsidiarity, which states that the European Union should act in those instances where lower levels, national level and regional level cannot resolve problems by themselves. So I think that we have that we have a lot of reasons and lot of objectives that we need to achieve in the area of healthcare on EU level. I didn't mention the pharmaceuticals. That's also a specific topic because we are waiting for the Commission proposals on the revision of pharmaceutical legislation. But this just shows us that there are so many healthcare topics, healthcare issues that are now being discussed and talked about on EU level, that definitely these kinds of events where we can get fresh and new ideas on how to act in European Parliament are very, very important. And I took the lead, and I've been following what you were doing closely. I know that you have 5 committees, you have 5 areas of expertise, and these are specifically those areas which I highlighted, like digitalization, sustainability, workforce prevention, etc. So all of these things that I emphasized as relevant on European level, you are also tackling today, and during your work throughout this mandate. So I think this is very important. I'm glad that I'm able to host you. I apologize for this small delay because of technical issues, but we are still kind of trying, after the COVID-19, we are still trying to organize ourselves in the Parliament. This is, we have the lack of people, lack of organization because of nobody expected this such a big influx of events that we are facing in the last months. So this is the reason why it's a bit hectic and chaotic here in the Parliament. But I hope that this will not cause any further problems. So to sum up, I'm glad you're here. I'm glad that I'm able to host you and to welcome you. And I look forward to your discussions and to hear your concrete proposals. And I hope that at least some of them will be able to transfer and to establish them as concrete initiatives, legislative or otherwise, by European institutions, by the Commission, Parliament, etc. Thank you very much.
Thank you. Thank you very much, Tomislav, for these words. You talk about challenges and opportunities, and I think that young people today in the Parliament, in the Year of Youth, this year has been declared the Year of Youth by the European Commission, is really what we are all talking about. So we transform those challenges into opportunities with your recommendations. So thank you very much, Tomislav, for once again being the champion and being the host of this discussion. Zeger Verkuterin, Vice President of Government Affairs and Policy, EMEA of Johnson & Johnson. Zeger, you will speak on behalf of all the partners. EU40 is, with Johnson & Johnson, one of the founding partners back in the days, together with the College of Europe. Then, years by years, we managed to bring together really a cohort of interest around the policy recommendations and the EHP. So I'm very proud. I want to know whether you are proud as well of this initiative.
You're challenging me on that, Alessandro. That's an easy one, because I'm sure I'm going to win that. But welcome, everybody, and I'm really excited to be here back with all of you in the same room in the European Parliament, which is really the home of the European Health Parliament. And it's almost like, I commented also with Adam, it's almost an emotional moment, because Alessandro doesn't know that, but it's the 7th edition, but it's already 8 years, because we got 1 year that we didn't really have an EHP session. because of the elections that were going on at that point in time. And so this is the 8th year, but it was also specifically in this room that we got together. And so it's amazing to see how we have been able to impact really so many young people already here in the region, but then also through the work of each of them, a lot of elements around us in the ecosystem here in Brussels. And I mean, it's really truly remarkable to be here with these 60 young people, a large part in the room, the others from their screens at home. And you have come from different countries, different nationalities, different professional backgrounds, sectors and so forth. But that's really the reality, and that's the richness that hopefully you'll find. Maybe not always that easy, but that is the reality also of all the policymakers. They need to bring together the interest of many different streams of interest. And you've come here to work together to tackle one of the most challenging, significant issues of our times, and that is really driving towards policy that fosters good health, well-being, that really matters to the citizens of Europe. And so I'm thrilled to be here with you because you have shown that passion for healthcare and that commitment to bringing about a change in the European policy landscape. And it's a big ambition. But you also know that this 2022 is the year of European youth. And so also it was the year that concluded the conference on the future of Europe. And what we have seen is that really the European citizens have been asking even more with regard to Europe playing a role in health, on healthcare, than really the Commission has currently in its program already kind of planned or even executing or proposing. So there is more that the citizens are asking, and the voice of the young generation is very important because also you can kind of have that perspective far more longer term, and that's why we want to make sure through this EHP we give you also a platform and a forum to kind of make your voices heard. And I couldn't be more proud, as I said, about really the impact that the EHP has already created through proposing disruptive and ambitious and yet impactful but practical policy solutions. And I hope this cohort is going to live up to that expectation to take that even to the next level. And it's hard to believe, Tomislav, when even if you remember less than 4 years ago, even under the Juncker Commission, there were scenarios on the table about the future of Europe where the European institutions would have no role to play whatsoever with regard to health. In today's world, we've seen a fantastic, unprecedented European unity to come together and really take on and building on the experience we just are going through or went through to really have the EU health policy agenda to be shaped. And so you are there at the right moment to really build on that momentum and don't miss that opportunity, I would say. And so it's clear that Europe has recognized the importance of collaboration beyond its borders, coordination, cooperation in healthcare, in matters that also the European citizens are asking. So it's not about going back to the old that we know for many centuries, business as usual, but it is harnessing this ambitious momentum and learning from really the experience and ahead of the conventional ways how we look at managing the sick rather than managing our health throughout our lifestyle. And so as Tomislav was saying, from the pandemic preparedness and cross-border collaboration to Europe's cancer beating plan and the pharmaceutical strategy to digitalization of healthcare and tackling the climate change. These are all vital changes and opportunities that must be addressed together with all stakeholders. We cannot leave anybody alone, and we need to be inclusive in our approach. So we are excited to hear the new and innovative ideas that you might have come up with, and I'm confident that the members of the 7th European Health Parliament understand the value of this collaboration beyond your own specific cohort. You have been incredibly ambitious this year, actively engaging already with stakeholders, the European policymakers, who were very welcoming, I understand, international organizations, NGOs, patient organizations, and experts in the healthcare field, in order to enrich your perspective, but also to drive the dialogue in the direction that you are believing we should be going. And as one of the founding partners as well, we are really, really proud of seeing that you've landed to this moment after 6 months and to present your ideas. So dear EHPers, I hope this has been an unforgettable moment, a moment that is a transition in your professional and your personal life, that you feel the call to action more than ever before, that it has connected you with what is the Project Europe, but also that you understand, even as young, healthy people, that caring about your health is something fundamental. And so I also want to extend the gratitude to the other partners who have made the 7th edition of the EHP possible. The College of Europe, our founding partner, as well as EU40, Alessandro, but also the European Patient Forum, PN Ketchum Plus, Euronews, Mavens, and the Young European Leadership, and the most recent partner, the European Health Futures Forum. I mean, the investment all these organizations make in you in order to equip you, but also facilitate to make sure that you can and really generate an impact with the work is really what we want, and we want to continue nurturing the young generation to engage in Europe and to co-create the future of healthy lives for all citizens. So big thank you, and I'm looking forward to your recommendations.
Thank you. Thank you very much, Zeger. I was almost cutting you short, but then you started with a thank you, and I couldn't cut you short over there, because that is really...
I know the trick.
Once again, a big, big thank you to everyone who made it possible, and to you guys for being here, listening, and being part of this conversation. Now, you mentioned something, Zeger, which I found it interesting, which is the ability that the EHP gives, once again, of connecting people. We really managed to bring together the European Parliament, private and public partners, young professionals in different policies, in health policies, in digital policies. So this is really what the EHP is all about. And so it is my pleasure, and I want to ask her what was her experience in a very short couple of minutes, to Eleonora Varntumian. I'm sure I butchered your surname. Apologies, I'm Italian. Nordic surnames are complicated. She's the president of the 7th edition of the European Health Parliament. Thank you very much for being with us.
Hello, everyone, and welcome to the European Health Parliament 7th plenary, final plenary. It's a real pleasure to share this room with you and those who are watching us online. This has been an extensive work, and I would like to thank all the EHP members. We have been working extensively. One of the great pleasures was that we were trying to create bridges. We had people from representing industry, patient advocates, pharmaceutical researchers. So it was really great to see that we have the different perspectives from many different European countries. And that was great, especially for bridging the gap between national and EU policies. At the same time, I would like to thank MEP Sokol and MEP Alieva for securing this room. It's great to see that you're supporting the voice of the youth and you're standing next to us. And also to the partners that are giving us this platform to raise our voice and to make an impact when it comes to European health policy making. I think this is the future right now, and it's up to us to create meaningful and impactful policies so we can create this historical moment of the European Health Union, all of us together.
Thank you very much, Eleonora. Again, I hope it was a great experience for you and for all of you, because the European Health Parliament has been proven to be something of which we as partner and the members of the parliament are proud of. But then at the end of the day, it's all about you and how much from now on you will be able to advocate for the policies that you've brought. Now, you've done the hard part, but the game is not over. We have not reached the final point. We have not scored yet. Now it's all about how you will make a reality the policy recommendations that you have brought, because that is a great material, and now it's up to the Parliament, to the European Commission, and to the Council to listen to you. So for me, that's all. Thank you very much to my distinguished panelists here with us, and I know that now each and every one of the committees will have to present. You will have a very tough job, which is to try to be short. We try to be as short as possible. Try the same, because at 4 we will need to leave the room. Thank you very much to all of you, and, welcome again to the European Parliament.
So before we start, I would like to thank you for being here. You can join the audience for now, and I would like to call my colleagues from the Digital Health Transition and Governance to take the floor with me. This has been one of the greatest priorities we have right now. We have the launch of the European Health Data Space, and this committee has been extensively working when it comes to data sharing, accessibility, skills for the workforce, and it's a great pleasure to see how we can use the data to improve well-being for our patients, to facilitate the work of healthcare workers. So let's see from this committee, are we talking about creating a resilient workforce, or are we talking about self-care using digital tools? How are we going to use this to leverage the momentum? Henrik, the floor is yours.
Yeah, thank you so much, Eleonora, for the kind introduction. And thank you for being able to speak at this really historic place here and this great audience. Most importantly, but thank you to this great committee, which can partly be here. I'm today here with my colleagues Jalak and Christoph, and all the other ones that have been part of this committee. 6 months ago, on the next slide, this committee here started a conversation, and it has always been led by the same question, namely, how would this pandemic have went if we would have had fully digitalized healthcare systems in the EU? On the next slide, we can see that we quite early came to a vision of how such a healthcare system in the EU should look like. It should be not about just data sharing, but really about a data sharing culture. It's not only about being equipped and upskilled, but healthcare and IT workers working borderlessly together. And not about only insights through data, but real-world decisions in real time. However, when we started then to think about policy recommendations, it became clear that these points you cannot tackle with one recommendations, right? And so we thought about our starting points to do the recommendations, and these are, on the one hand, specifications we call for within the European health data space. My colleague Jalak will later on speak about what it needs still to innovate in a digital European single market. But first of all, we want to speak about it's necessary that the healthcare workers and the patients are upskilled and equipped to be in such a digitalized healthcare system. And who else could speak about this than my dear colleague Christoph, who made it all the way here from Frankfurt after a long night shift in the hospital. Christoph, I give the word to you.
Thank you very much, Henrik. Good afternoon, everybody. I'm really happy to present our recommendations concerning digital health literacy. My job as a radiologist or as a neuroradiologist in a university hospital is mostly digitalized. Medical imaging data is nowadays generated, stored, analyzed, and transferred digitally. And this is only the beginning. The number of digital solutions in healthcare is continuously increasing. In this process, we have to focus not only on hardware and software, but also on the people using it. They need to receive appropriate training. Therefore, we recommend that sufficient funding opportunities should be dedicated to digital health training or digital training. This could be done under Horizon Europe, EU for Health, Erasmus+, or the Digital Europe program. The EU should also support the implementation of digital skills modules to national healthcare professionals' curricula to enable them to classify evidence from artificial intelligence solutions, to increase their understanding of data privacy, and to improve communication skills, for example, in telemedicine settings. The increasing number of digital health solutions often has a negative side effect too. Instead of support and relief for healthcare professionals, it creates additional pressure, sometimes without significant value. To unlock the full potential of digital tools, a co-creation process between developers and healthcare professionals is crucial. Therefore, we recommend that a working group of healthcare professionals should be established to ensure a co-creation process within EU-funded projects. This could be done within the European Digital and Health Data Board, which is mentioned in the proposal for the European Health Data Space. The definition of standards, the design of interfaces, and the user experience should not be left to the industry alone. They should be co-defined by healthcare professionals. Empowerment of healthcare professionals in digital health is very important, but it's not enough. For the improvement of digital health literacy in Europe, we need to include all citizens, no matter of their job and also independent of their location, their age group, or other features. Therefore, we call the European Commission to support all European citizens to improve their digital health skills. This could be done by funding and adapting the existing programs mentioned before, but also in cooperation with member states, which could implement digital health literacy as a part of general health education in the national school curricula. In conclusion, we strongly call European policymakers to adopt an EU digital health strategy, targeting European citizens in general and healthcare professionals in general, to leverage the benefits of digitalization in healthcare.
Thank you so much, Christoph, and all the great work that you did on digital health literacy. You already mentioned the European Health Data Space, which has been published as we were finalizing our recommendations. And our committee in general welcomes this important step in bringing data exchange closer in Europe that has been done with this publication. However, we call for a few specifications there. As you know, every digital interaction also in the healthcare space produces data. But if you want to harness the full potential of this in healthcare, you need to collaborate. And traditionally, this requires exchange of patient-level data, but there are always concerns about this with regard to GDPR, and for a good reason. However, the European Health Data Space has an answer for this, and this is called Federated Data Network. In Federated Data Network, the analysis comes to the data and not the data to the analysis, right? So the data can stay where it comes from, maybe in the hospital or with an organization. However, what we are still missing in the EHTS proposal are some specification on how it's being done so it can be really widely used within the EU. And therefore, we recommend to set up a consortium that does first define a standard, a common data model, only one in the EU. And that should be the OMOP common data model that has been already used in very successful projects such as IMEI, AIDEN, HONOR, and is also used in the EMA federated data network called Darwin. Secondly, this consortium is supposed to provide guidance on how this data can be used for regulatory and HTA decision-making. And therefore, this consortium is supposed to propose input on trial design, endpoints, and most importantly, a registry where all studies in federated data networks are being registered, as it's done for clinical trials already. And last but not least, it's important to address the issue of intellectual property in federated data networks, which is also important for the field on innovation. And here I give over to my dear colleague Jalak, who's an expert in startups in the EU and speaks about innovation in a European digital single market.
Yes. Thank you, Henrik. Thank you, Christoph. It's great to share the stage with you guys. I would like to talk more about the innovation that has been happening within the EU, because we believe that digital transformation is at the core of more patient-centered solutions, but also more cost-effective solutions, as well as improving the quality. And we also believe through our analysis that SMEs, so small, moderate enterprises, are able to fill in the gap, the existing gap that has been prevalent within the healthcare systems. But to actually analyze the hurdles that these SMEs face, the methodology that we used was a quasi-qualitative study in which we surveyed many enterprises, 21 in total at the moment that we were doing our recommendations, but the survey is still live, and still we get more data onto actually the potential hurdles that they face. And we have summarized it down to 3 main hurdles that have been occurring, and I would elaborate on that. And and also the recommendations that we want to give out. So the first hurdle is that there needs to be more emphasis on recognizing the unique nature of digital health innovation in regulatory pathways. As this is still quite scattered, and therefore there's no one particular streamline in regulation, we suggest that there should be more preliminary AI approval. So technologies that use AI, they should have a particular fast track of approval with detailed guidance if possible and if necessary. We also believe that streamline in oversight is very important, in which also the preliminary data that has been collected by that particular innovation is already being analyzed, and therefore the process can be potentially fast-tracked. And also we believe that to overcome this hurdle, it's necessary to have more dialogue between innovators and people who are reviewing, so the EU, that there is more dialogue between them, and this can happen through an existing platform already, or maybe elaborating platforms in which this dialogue is possible, so that the hurdle is actually kind of faced in the preliminary stage. The second hurdle that we saw was that the adaptation and facilitation of reimbursement mechanisms needs to be improved, because as the guidelines, also the reimbursement pathways are also still scattered. So we suggest, or we strongly recommend that a consensual definition of criteria in order to get the reimbursement is being clarified, and it's being specifically dealt with. In doing so, the European Commission should build on existing initiatives and pilots, such as the fast-track process in Germany for the DIGA has already been set in place. I think that could be a great plan that EU should look into, and also make that available within within the EU as well. Also, clear guidelines for HTA, so health technology assessments, need to be set in place, because often what happens is that these SMEs are not able to go through these HTA approvals again and again, as they can be quite expensive. And the third hurdle that we saw was that the increase in funding opportunities for digital health entrepreneurs needs to be elaborated as well, and this needs to be expanded as well. This should be done through more targeted funding opportunities for these entrepreneurs. And also the existing funding opportunity portals should be improved as well, and they should be highlighted for these entrepreneurs in order to be involved. And the third criteria, or the third recommendation for this hurdle, to overcome this hurdle, should be that venture center of excellences, so platforms in which venture capitals or venture developers can collaborate with these entrepreneurs, should be highlighted as well. I work at a venture developer, one of the leading venture developers in the Netherlands, and we see this often, that there is not enough information for these entrepreneurs on how to obtain funding from the EU or elsewhere, and this needs to be targeted as well. So that is related to the innovation part.
Thank you so much, Jalak, for not only for the presentation, but also for the great work that you did here. So you heard our recommendations on digital transition and governance in the EU in healthcare. We know that you're all experts in one way or the other in this field, and we are really, really happy to hear now your questions, your inputs, and your remarks on our recommendations.
Thank you.
I suppose everything is clear, and since we have no questions, I would like to thank my colleagues for the great work they have been doing. You can join us in the audience, and then we can start with the next round for the Sustainable Health Systems Committee. What is incredible about this initiative is we are experiencing right now in the European region excessive flooding, and then we have wildfires. Climate change is happening within the European region, and it's up to us to take concrete actions, all members together, so we can tackle climate change with the concrete steps. This committee has been tackling issues from environmental issues, economical and social determinants to create sustainable health systems. So let's hear what they have to say in light also of the EU Green Plan. What are the proposals to strengthen and create a resilient European Health Union? Laura, the floor is yours.
Thanks very much, Eleonora. So next slide, please. So very happy to be here today for the Sustainable Health Systems Committee. So let me see. To start off, I suppose the rapid implementation of policies and strategies across Europe against the coronavirus pandemic demonstrated the effectiveness of the European Union against the common threat when it is deemed urgent. And we believe, as a Sustainable Health Systems Committee, that climate change is worthy of a similar response. The development of recommendations for sustainable health systems was a really difficult task, as the relationship between healthcare and the environment is multifaceted, wide-ranging and very complex. Next slide, please. So sustainability focuses on the nexus of the environment, economy and society. While several definitions of sustainability exist in health systems, we chose to define sustainable health systems as being environmentally neutral, economically fair and socially inclusive. We believe that the key to effectively achieving sustainable health systems is through identifying and targeting synergies that exist between these dimensions in order to improve health for all communities. So via our recommendations, we propose that sustainability in health systems is therefore defined holistically and should increasingly be seen as an essential dimension of quality akin to equity or accessibility, with mechanisms to monitor and hold the system accountable for its environmental performance. Only then will we be able to achieve significant change and generate a sustainable health system for all. So although the topic of sustainability, as we all know, has been on the agenda for a number of years, we believe that the time for effective and long-term interventions is now. We therefore urge policymakers in Europe to prioritise synergistic and policies and strategies that target human and planetary health in tandem. We would like to thank our wonderful mentors, Dominika Damaska from Johnson & Johnson and David Somek from the European Health Futures Forum, who are here today, who offered us great support and guidance in this experience. We'd also like to thank all the people that endorsed us for believing in us and our vision for the future. Next slide, please. I am proud now to introduce three of my committee members, Marcel Venema, Julia Kupa and Anna Coutinho, to explain the three pillars that we chose to address: strengthening the role of communities, greener materiality of health systems, and lowering the healthcare impact on climate change by reducing emissions.
Thank you, Laura. In moving forward from the pandemic, we believe that the role of communities will be important in regaining citizens' trust, in promoting transparency in decision-making, and reduce inequalities in access to care. Next slide, please. In light of health systems challenges, healthcare is anticipated to become more community managed instead of centrally governed. And to facilitate this transition, we need to revise the formulas that are being used to allocate health budgets so that they better reflect the different needs of local communities. Next slide, please. These needs are best identified through greater involvement of communities in health planning and decision-making. But we need European guidelines so that member states are correctly guided on implementing participatory spaces so that they do not lose the original purpose, and to ensure that structural inequalities are not reinforced. Next slide, please. On the provider side, we believe that more can be done by bringing in other primary care providers, such as pharmacists, in dealing with minor health illnesses. We call, therefore, upon the European Commission to convene a dialogue with relevant stakeholders on how to better include self-care policies and find adequate incentives for better further support in promoting safe and effective self-care. Next slide, please. Empowering communities and strengthening engagement also goes hand in hand with effective health literacy strategies for patients and consumers to be able to raise their voice, for healthcare providers to better adapt their communication to people with different levels of health literacy, and for governments to build their capacity in engaging with communities. And therefore, we advocate for a European health literacy awareness plan that encourages member states to share their experiences with other member states on how to best implement health literacy programs. And now we will move to the second pillar, presented by Giulia Culpa. Thank you.
Thank you, Marcel. Next slide, please. Active pharmaceutical ingredients enter waters and soils during manufacturing, use, and disposal. Pharmaceutical emissions affect our ecosystems and have been shown to have adverse effects on human and animal health. They also contribute to the spread and development of antimicrobial resistance. To mitigate these negative impacts of pharmaceuticals in the environment, our committee proposes to look at the entire medicine life cycle to identify, fund, and promote greener solutions for manufacturing and discharging pharmaceuticals. Next slide, please. Transitioning to greener medicines cannot be achieved without transparency. This is why we call on policymakers to strengthen the environmental risk assessment of human medicines in the upcoming revision of the pharmaceutical legislation. This can be done by including the ERA in the benefit risk assessment for human medicines and extending it to the so-called legacy products. Next slide, please. The life cycle approach requires a structured dialogue of diverse stakeholders. The Commission could play a role in setting up a multi-stakeholder platform and scaling up best practices already established in member states. This could feed into the development of an EU-wide policy on mitigating and managing environmental risks of medicines. Next slide, please. Where prevention should play a primary role in limiting pharmaceutical emissions, in water areas of high pharmaceutical concentrations, more stringent rules and measures are needed to protect human and planetary health. The revised EU water legislation should account for those risks by ameliorating water treatment systems. Next slide, please. Finally, public authorities have a role to play in working together with manufacturers to employ waste minimizing measures as long-term and cost-effective solutions to the problem of pharmaceutical emissions. This could include extending medication shelf life, choosing the most sustainable storage solutions, and adjusting packaging sizes.
Thank you, Giulia. Now for our last pillar on reducing emissions, we will listen to Ana Coutinho. Please go ahead.
Hello, everyone. So heading to our last pillar, it is important to highlight that the health sector represents more than 4% of the world's carbon footprint, and that some efforts to reverse this are already being done, such as the anticipation of targets for reducing gas house emissions, or the recent Memorandum of Understanding for cooperation between the WHO and the NHS in England. Looking at the major contributors for this reality in health sector, our committee proposes to address these areas with the following recommendations. Next slides, please. Environmental sustainability considerations can be incorporated during the design, construction, or even the rehabilitation of buildings. In order to incentivize European countries to become environmentally sustainable, European Union funding programs must be fostered to support innovation at all levels of health system, from buildings and energy use to equipment. Next slide, please. To take action and monitor progress, we need data. So it is critically important to create a more outcomes-oriented system with greater incentives for the upstream approaches to care by developing data-driven improvements in health outcomes of individuals, populations, enabled through climate-related health outcome data, standardization, and collection. This will enable the implementation of value-based healthcare through effective partnership, governance, and funding sharing models in the future. Next slide, please. is there. Thanks. Anesthetic agents are one of the biggest sources of greenhouse gases in the operating room. However, its waste can be reduced by developing different anesthetic gas management strategies, including anesthetic choice and reduction, or capture and reuse of residual anesthetic gases. Having sufficient investment in technology development to ensure this will be fundamental. Next slide. Despite supply chain emissions are one of the largest sources of greenhouse gases, it is also the most difficult to influence directly. Looking at how new technologies and innovations are being developed, we must require low carbon substitutions and product innovation in the supply chain, ensuring that suppliers are decarbonizing their own processes. At the same time, launching a supplier engagement program to encourage carbon transparency reports from the suppliers will enable a transparent and tangible approach.
Thank you, Anna. So these were very brief, our policy recommendations on sustainable health systems, and you'll find them in more detail in our EHP7 book, which will be published either today or this week. So to conclude, we were supposed to hear from MEP Brando Benefei, but he has not arrived yet. So maybe we can move to questions first and see if he arrives.
Yes, go ahead, please.
Hi. What about single-use plastic in healthcare system? There is like huge waste of single-use plastic coming from the healthcare system. How about recommendation to change it to something more sustainable?
Anna, do you want to take this question?
Well, we could look at it as a huge problem within our work, but we weren't able to look at every part of that first cycle I showed on our presentation. So there were a lot of possibilities, and we just chose some that make sense for us as a committee, and that we thought that could, in a certain point, connect with each other within these three pillars, because if we look at them closely, we can understand that there's some connection between all of them. So we didn't put that approach on our work, but it's, of course, something to look at in the future.
Thank you. Now, to conclude our session, we're pleased to have Brando Benefei with us. He's a member of the Progressive Alliance of Socialists and Democrats and joined the European Parliament in 2014. Brando, the floor is yours.
Thank you for this invitation. I have to say it's not the first time I address the European Health Parliament. I'm happy that this initiative, despite all the difficulties of these years, has been continuing. It's been also supported by, I have to say, EU40, of which I've been active from the beginning as a relatively young MEP, already elected in 2014. I think it's very important that also in this field we support the development of skills, support for development of new opportunities, new also people getting to to this kind of health professions, and to support also in a dialogue that obviously has these moments, but also stays, we can say, active all the time during the year through direct exchange with the policymakers. So I'm happy, and I see also some colleagues here, and I imagine you had a very active debate. I will try to give you some final considerations from my side. I'm sorry I couldn't, because of commitments in the Parliament, to be here before with you, but I hope I can give some interesting remarks. And obviously I will pick up together with my colleagues on all the work that you have been doing. As I said, I know the initiative for already a long time, and I really appreciate the fact that you have been working on this with continuity, which is very important. The call of this year's edition to recover, reinvest, reinvent responds to a reality of a post-pandemic Europe which needs to be able to resist shocks and needs to embark on a new course of sustainability, resilience, and central role for the patient, if we look at the topic that obviously have been at the center of your debate. Impact of climate change and environmental degradation, as well as persisting health disparities, require more and more urgent action at EU level. The healthcare sector remains a contributor to the world's carbon footprint, with 4.4% of the global emissions. So also it needs to be part of this effort of reducing our impact on the environment. So this is an important point. And the Sustainability Health Committee's policy recommendations clearly capture the importance of adopting a holistic and horizontal approach to health that extends beyond the healthcare sector. I remember that in one of the previous editions we were working a lot together on skills, for example, and I see that again we are focusing on the need to engage citizens in the sustainability of our healthcare systems. Participation and engagement outside the bubble, it's crucial, and I know you have been discussing about that. And we need patients and citizens at large to be better informed on the healthcare systems, and so they can make better informed choices in decisions about their health. Also with colleagues that are here, we have been working on innovation, on how we can unite this effort for sustainability with the use of new technologies to pursue also social objectives. These can be together. Sustainability, healthcare benchmarks to be reached in terms of equality of access, of affordability of therapies, and the new technologies. They can be part of a common effort. And I have to say that the Conference on the Future of Europe, of which I've been an active member of the plenary and working until the end in this very interesting experiment that I hope will become a permanent feature of permanent exchange between citizens and the institutions. In that context, we concluded very recently a 8-9 months work of the conference. Health has been very important. We had one working group dedicated only to that, chaired by a commissioner, Commissioner Šefčovič, and it's clear from the outcomes. You can also read the broader recommendations that there is a strong call for a real health union. Proposals to improve health and well-being of citizens of Europe by having a more coherent health policy approach at European level. Not just funds, not just small initiatives, but much more a European dimension of health. It means on patients' rights, on access to skills and training for healthcare professionals, on technological infrastructures that I was also mentioning earlier, etc. I need to be frank with you. Health risks to be, as I say that as a politician looking at the broader picture, risks to be used as the obvious thing that after the pandemic should be put in a stronger common competence at European level. But the truth is that even the health union, which seems so obvious now that we need it, it's so intuitive. I hear colleagues, but also governments that were so much against this. Now everyone says that at least to some extent they want to do it. But be careful, because if we just go on a very fragmented approach on this, I don't think we can do what we really need to do, because we need a broader leap forward in terms of a political union at European level, so that some common goods at European level, one of them is health, obviously, but also infrastructure, also investment for sustainability, also the access to technology, they need to be put in a broader framework of reform and advancement of the Union. At least this is the kind of reflections I want to bring to you. Health cannot be put as a sectorial objective, because now it's easy to discuss about having a step forward on a health union. It needs to be put in a context of more holistic action, as I was saying at the beginning. Obviously, supporting investment into greener manufacturing and discharging of pharmaceutical, coupled with facilitating stakeholders' collaboration, increasing health literacy, are very important points that I know you have been discussed, that are very important for this sustainability aspect. I think that it's very important for me, just to conclude, to underline also one issue I work a lot with, that is data, because I am the artificial intelligence rapporteur of the European Parliament for the regulation on AI. The way we use data in a very sensitive sector as health, as you can understand, I don't need to tell you anything about that, will be crucial for developing better research, obviously, for science, but also to deliver better services to our citizens, reducing carbon footprint, because if you can do more with e-health instruments, for example, you can reduce the amount of movement of patients and the usage also of bigger and more polluting structures, also as healthcare facilities. So as you see, things are connected, and I see that from my work, and all of us, all the colleagues here know that from their work. So I think it's very important that we continue working together, that stakeholders like you are a certainty, as I said, after many years of work together, continue discussing and are able to deliver in these last 2 years of this mandate of the European institutions. We need to deliver this post-pandemic, hopefully post, and however complicated world we are living in for various reasons, we need to, I hope we can deliver, as I said, many of these objectives that we are working on. I don't think we have a choice, because you see what's happening with our environment around us, with the heat and with the impact also on health. We know that this has a direct health impact on many people, especially on the most frail ones. And so we need to react, we need to act. And so thank you for your effort, your ideas on this work, and we are, I'm sure I can say, in the name of all colleagues, we are ready to continue working together. Thank you.
Thank you very much, Brando Banifei, MEP. It was a real pleasure to share your insights with me. I would like to thank my colleagues for your great work, ask you to join the audience so we can continue with the next Committee on Preventive Health Self-Care. This committee is touching upon a very important topic when it comes to prevention and self-care, when it comes to patients and also healthcare workers. Right now is the momentum with the Healthier Together EU and CDC initiatives, which is touching about cardiovascular diseases, diabetes, respiratory diseases, mental health, neurological disorders, and health determinants. So it will be great to hear from you. How do you think we can tackle the issue of NCDs? And of course, we have the great pleasure to have with us Susana Solis Perez, who was supporting us from the second plenary until today. So it's a real pleasure to have you today. The floor is yours, and we can start the discussion.
Thank you very much. My name is Alina Kastiva. I am a chair of Preventive and Self-Care Committee, together with Ekaterina Larkova, my vice chair, and our distinguished guest, Member of European Parliament, Susana Solis Perez. Thank you very much. It's my pleasure and privilege to be here today in European Parliament and share results of our work. Thank you for this fantastic opportunity. And I am delighted to introduce our Preventive and Self-Care Committee, who consists of 12 talented members representing different parts of healthcare ecosystem and who are passionate about driving prevention and self-care and committed to drive positive change for healthcare in Europe. Thank you very much. Next slide, please. We would also like to express our sincere thank you to all our supporters, mentors Marco Korinjak and Thomas Leon, and of course our endorsers for their valuable insights and ideas who helped us make our recommendations even more impactful. So thank you. Next slide, please. When we all, previous slide? Yeah, thank you so much. When we all met with our committee members end of last year, we realized we have very different experience and expertise. But what united us is our passion about prevention, especially towards non-communicable diseases. So why NCDs? Because it still remains a major concern for healthcare in Europe. But good news, and we do have good news, that if we focus early enough, if we invest in prevention, if we put attention to education and self-care, then many of these non-communicable disease cases can be reduced. Every euro invested in prevention and self-care can bring us positive outcome, can improve quality of life for people across Europe, well-being of our patients who suffer from NCDs, but also bring a very positive economic output. Next slide, please.
Thank you, Alona. Today, we should also not forget about the impact of COVID-19, of course, that caused broad disruptions to health services, creating a backlog in addressing NCDs. And on the other hand, it also drew more attention from policymakers to the needs of people living with NCDs. In this context, we are very much welcoming the European Commission Healthier Together initiative, in addition to the flagship initiative Beating Cancer Plan. And we are very grateful for the opportunity to have contributed to it among other stakeholders. While the importance of addressing NCDs is finally on the EU health agenda, we still need stronger political will and leadership to drive actual change. And what I mean by this is that we can often see great initiatives, strategies, plans, but the problem is implementation. Our recommendations are based on the existing policy priorities and built on the work carried out by different policy stakeholders at different levels. And we focus on a dedicated set of important longer-term structural changes, but also on a number of specific and pertinent policy interventions that can be done more like in a shorter term and help improve NCD prevention and implementation at the European, country, and local levels. And that is why, if we go to the next slide, when we speak about the implementation, the first thing that can help is actually the structural, it is at a structural level. We actually saw that research shows that the key factors for the most efficient interventions are clear responsibilities among the institutions, sufficient funding, but also strong performance management system. And with this in mind, we would like to encourage creating competence and clear responsibilities for NCD prevention, control and monitoring at the European but also at the national levels. And this can be done at the European level by finally expanding the mandate of European Centre for Disease Prevention and Control to NCDs. And then at the national level, it can be done by introducing a special national organization or an agency that can be accountable for the implementation of preventive health literacy program, for example, and also improve public health. Successful examples of such organizations can be seen in Denmark, Sweden, Singapore. Finally, and additionally, we would also like to encourage the European Commission to initiate an assessment of different existing NCD prevention frameworks. This can be potentially done under the Healthier Together initiative. And now I pass it forward to Alona.
Thank you very much, Katerina, for sharing some structural recommendations. And I will share a couple of recommendations we think can be implemented relatively soon and can have significant impact. So one of them is creating a sustainable health-enabling environments. What do we mean by health-enabling environments? Of course, it's healthy diets, it's reducing the risk of exposure to tobacco and alcohol, and very importantly, encouraging physical activities. So what do we particularly recommend? In regards to healthy diets, we suggest to minimize exposure to promotion of unhealthy food starting from early age, also children in school. At the same time, encouraging exposure to nutritionally rich food. And we can do so by introducing specific minimum criteria for public procurement of food in schools and public institutions. At the same time, we encourage European Commission to be tougher and execute duties on tobacco and alcohol. And very importantly, we encourage of creation a cross-cutting fund that can enable physical activities, especially for group of populations in Europe who have limited access to healthy lifestyle and physical environments. At the same time, next slide, please. We do believe that in addition to sustainable health environments, it's very important to invest attention and promote education and self-care. So hence, we recommend that sufficient attention to self-care starting from early age and including modules on prevention and self-care in school curricula. We also believe that important component on top of education is expanding pool of healthcare professionals who can promote and educate public and patient on prevention and self-care. And that means introducing basic modules on self-care into mandatory curricula for pharmacists and primary healthcare physicians. Next slide, please.
And now we go to our final pillar, which is about improvements in terms of early diagnosis and screening of NCDs. So, of course, one of the ways to address that would be through digital technologies. And we all know that there are so many digital apps and technologies for health available worldwide, but the problem is that these tools and technologies are not well integrated in day-to-day practice by healthcare professionals. And that's why, as one of the steps, what we would recommend is actually to provide healthcare professionals through continued medical education to use those digital technologies, those early diagnosis tools, digital biomarkers, self-care, and self-management tools. Another piece which is also very important for early diagnosis is also driving positive change and encourage healthier behaviors. And a big piece of that is, of course, awareness of your own health and willingness to go through, let's say, general checkups on a regular basis as a preventive measure. But to encourage this, it should come from different sides. And it should come also from general public. But for that, they need some special incentives. And we believe that providing working people with paid leaves, for example, to perform general health checkups and go through NCD, early NCD diagnosis examination as part of sick leave, for example, or sick pay benefit schemes could encourage people to take more care of themselves. Here, I would just like to invite you all to actually read our recommendations, because there you will be able to find a bit more on how when we speak of implementation. And I would like to conclude our part on the recommendations and take it further with our special guest, Member of the European Parliament, Susana Solis Perez. And Susana is member of Renew Europe Group. She's member of Committee on Regional Development and, among others, also substitute on Committee on Environment, Public Health. And importantly, Susana is also Vice Chair of MEP Interest Group on Obesity and Health System Strengthening. So thank you very much, Susana, for your time to join us today and to share your thoughts and your perspective on how we could improve NCD prevention in Europe. Let me probably give you the floor for a couple of introduction words, and then we'll proceed with our committee members' questions.
So thank you very much. It's a pleasure for me to be here. I'm very happy for the invitation, but I want to thank you for your work, because I was following the European Health Parliament for years, and for me it's a great initiative to bring young people together to pave the way and to define the policies of the future. So congratulations for your work. Also congratulations for your policy recommendations. I'm not sure if I can add something else on what you have already done, but thank you for inviting me and for tackling such an important topic, because as you said, it is important because of the burden of our health system. It is important because it's one of the most leading causes of premature deaths. And those numbers that you have presented could be even worse if we take into account the aging population and that we have not seen yet the effects of COVID pandemic on NCD diseases.
Thank you. Thank you very much, Susanna. And now I would like to actually give the floor to our committee members for their questions to Susanna. And we will start with Christos Tsakakis from our committee. Please go ahead, Christos.
Thank you. Thank you for your positive remarks about our recommendations. My question would be, in your opinion and in your experience, what should be the priorities of Europe for a better and improved prevention and self-care strategies for non-communicable diseases? Thank you.
So thank you very much. I think what you have presented here today is clear, that we know how to tackle NCDs. It is through prevention, through early diagnosis, and that is why we should put all our efforts together to ensure that these diseases are avoidable. So in order to do so, I think we have to invest in public policies that shed light on the implications of habits that you have already defined here. And I am referring to a healthy lifestyle, like you mentioned, and to prevention and early detection. And I would like to add here something that maybe we should have into account, because the role of the primary care systems is essential. And I would like to draw your attention on something that happens all around Europe, and this is the shortage of qualified health workers. I think 22 of 27 countries report a shortage of healthcare professionals, and I think this is we need to invest to guarantee we have qualified and sufficient levels of well-trained staff. So in essence, I would like to have this holistic approach that the Commission is taking. I would say investment in awareness campaigns to promote healthier lifestyles. Prevention is always better than investing in the cure, as the Commissioner said. Second, strong primary care system focused on screening and early diagnosis. We need qualified healthcare professionals. And third, access to treatment. Access to treatment whenever you are in Europe, reducing inequalities across the EU. And of course, in this holistic approach, I would like to draw your attention to mental health, which has been exacerbated during the crisis, and this is more important than ever among young people.
Thank you very much, Susanna. I would like to invite another member of our committee, Giulia Anchilotti, for the next question.
Yes, thank you very much for your contribution, and hearing from you about these priorities on how to improve NCD prevention in the EU. What do you think can be done to better implement these NCD prevention frameworks and self-care, both at the EU level and at the national level? Thank you.
So thank you very much. I think coordination is key. And the good news are that the Commission and the European Commission has already presented this initiative, the Healthier Together. And this is a good starting point, because we need coordination among member states, we need guidelines, and we need a common framework, although we know that the health competencies are in the member states or in the region. But coordination, and this is an important step, and that the Commission has already presented this initiative with 156 million euros to fund it. This is important. Then for me, the second thing is involve all relevant stakeholders, as we have seen here today, private and public, young people, and that is why I welcome the creation of this steering committee that will help put together all the knowledge, and we are able to exchange best practices among member states and to turn these best practices into concrete policy actions. And third, I think we need financial support because we know how tight and we constrained are our national budgets, health budgets. And that's why we need to take into account all the available funds we have in the European Union, not only this new initiative from the Commission, but also we have to take into account the structural funds, the Horizon Europe funds, the recovery funds, and to make sure that we have enough funds in order all people have the treatment. So I think we are this is a good news that the Commission is doing, and I know that the Czech presidency that will take over the Council in the next month, it will be also a high priority, this tackling NCD diseases, so it's a good news.
Great. Thank you. Thank you very much, Susanna. And maybe we have time just to take one last question from our committee member, Daniele Fernandez.
Thanks, Katja. So that is indeed good news that this is also being put on the agenda. I wanted to know, in your opinion, what do you see as challenges that we'd have to look out for in terms of NCD prevention policies?
One challenge is how to measure the results, the success, and this is why very quickly. But it is important to have data, to have KPIs, and to make we can follow up the success. So the good news is that this European health data space that is going to be a reality in the coming years will help us, to policymakers, to have informed decisions, and also to now that the funding is having success and that we are in the right direction. So finance, but data is also important, I would also say.
Fantastic. Thank you very much, MP Solis, for your intervention. And also to my colleagues, I would like to thank you for all your work. I will ask you now to join the audience, and then we can move on with the next committee on future-proofing healthcare systems. Being a bit mindful of time, we will need to be a bit short and to the point so we can have enough time for everyone. The Future Proof Committee has been tackling cross-border collaboration. We can see this from all the issues that we are tackling right now, and I think it's a great opportunity to let you know that the European Health Parliament will launch a 2-page document about migration. So we have so many difficult issues to tackle, but if we collaborate, EU member states all together, we can tackle this, strengthen our healthcare systems, and then improve quality of life for our patients and healthcare workers and citizens around Europe. The floor is yours, Norbert.
Thank you, Eleonora, and good afternoon, everyone. So my name is Norbert Kwepel, and as chair of the Future-Proofing Health Systems Committee, it's really my great pleasure to introduce this session of the European Health Parliament Final Plenary meeting. If you can have a previous slide, please, actually. Thank you. To start with, let me introduce you quickly to the 12 members of our group. So we came all to the European Health Parliament with our different perspectives from all fields of healthcare, forming a truly multidisciplinary group from policy to clinical practice, industry, regulation, research, or academia. So most of the committees are actually in the room today, and I wish to start by thanking all of them for their amazing commitment throughout the past months to deliver the policy recommendations we're presenting today. Next slide, please. So how do we future-proof health systems? This is a fascinating question we strive to tackle. It is also, of course, undoubtedly timely, as we know the COVID-19 pandemic has shown an unprecedented light on critical issues in our health systems, whilst we also all know that health crises, risks, and challenges are inevitable in the future, and that the current increased attention to health policy presents a chance not to be missed. But first of all, what does it actually mean to future-proof health systems? So you can see here the headlines of the definition which our group felt the need to develop very early on in our work. This definition is articulated around 3 key requirements. First of all, resilience, making health systems strengthened yet flexible to accommodate ongoing health threats, responsive to the evolving needs of society, citizens, and patients, and equipped to absorb unanticipated health crises. Second is equality and innovation, through the delivery of health as a collective social good and as a right for all people and communities, whilst also making the best of research and innovation for the advancement of health science and practice. And third, inclusiveness and ambition, by enacting collaborative and accountable governance, allowing all to be the informed and active builders of the future of health. So we'll be telling you a bit more about the specific recommendations we have constructed based on this definition in a few minutes. But before this, let me thank all stakeholders, experts, and decision makers who across Europe and beyond provide us with their input, contributions, and support along this endeavor. Next slide, please. Therefore, and to represent all of them in a way, we will now be playing a video in which two of them wish to provide us with their reflections on the topic and support to the work we have been doing together. I'm therefore delighted to now pass the floor to Dorli Carr-Gottlieb, Secretary General of the European Health Forum Gastein, and Nick Klasinga, the Head of the Healthcare Quality Indicator at the OECD.
Hello, my name is Dorli Carr-Gottlieb and I'm the Secretary General of the European Health Forum Gastein. For those of you who don't know the EHFG, we have offered the platform for European health policy debates for the last 25 years. I think we all agree that the pandemic has starkly revealed the lack of competences in health on EU level. The EHFG has since facilitated the European Health Union initiative, which calls for more health in the EU and for more EU in health. There often seems to be a misconception that a stronger EU role will weaken member states' role in health, when actually, this would ensure that national health policymakers will be the ones to take decisions on health on a European level. We're supported by a group of prominent experts in health, and it would be great if you could support us by following us on social media and signing the manifesto too. We strongly support the Commission's European Health Union initiatives, but more must be done, as it is also stated in the EHP's recommendations. So let's work together towards a true European health union. Thank you.
First, let me congratulate the European Health Parliament for the nice document they produced, the future-proofing of health systems. I recognize that a lot of ideas there are totally in synergy with the thinking of the Organization for Economic Cooperation and Development. And that should make sense because if you put health central, health is one of the main components of well-being, and creating well-being for populations is one of the major paradigms of the economic thinking at the OECD. I also noticed that the key issues of sustainability are addressed: financial sustainability, the sufficient human workforce over the coming decades, systems being able to adapt threats, external threats like a pandemic, and to some extent the sustainability which is related to environmental issues. So it's good to see that you, in your document, you come with some concrete suggestions. I just want to strengthen some elements as a close: the importance of prevention in healthcare, the importance of having efficiency and equity and balance in looking at the performance of systems. And for doing that, the importance of having good data. So the real strengthening of data infrastructure and turning that in information will be key in the coming years in assisting the member states, also in the EU, of really turning themselves in learning health systems. Success with your meeting.
Thank you again to Dorli and Nick for their amazing support. So now is the time to look in more detail at the recommendations prepared by our committee. So Europe has been at the center of the COVID-19 pandemic, so moving forward, European leadership is really key. At the same time, health is an integral part of everybody's life. So beyond risks, it's also really important to provide positive perspectives. And finally, it is also essential that today's historic moment is seized to draw the right lessons from COVID-19, rethink our health systems and policies, and build back stronger. So for these reasons, we aim to provide what we call a roadmap towards a safe and desirable European health destiny. To achieve this vision, we have outlined a series of 9 practical and high-impact policy calls around 3 pillars corresponding to the 3 requirements of resilience, equality and innovation, and inclusiveness and governance. To take you through these 3 pillars, we are now going to hear from 3 of our committee members who contributed to this work, starting with our member and EHP Communications Officer, Leroy Lepelars, on health systems resilience. Leroy, the floor is yours.
Thank you, Norbert. I must say I'm very thankful to be here in front of you. This is a situation we wouldn't have imagined for the last couple of years. The COVID crisis has really exposed our weaknesses in our healthcare systems, and we, the Future-Proofing Health Systems Committee, have really focused upon trying to prevent COVID 2.0. So that's why we focused on specifying the role of the European Health Emergency Preparedness and Response Authority, EU-HERA, for which we found 3 responsibilities. First is representing the EU in health threats and research efforts on a global level. Second, hosting a central pan-European health resources platform to match health capacity with the health needs. And third, to take the lead in mobility, coordination, and redistribution of health resources across Europe. Now that we've established the role for the EU-HERA, I'd want to imagine what is happening right now in the Saint Michel's Hospital right now here in Brussels. Yeah, we don't know. We cannot see it right now, and I just want you to know that we cannot see everything. We cannot even see some things that we cannot even see with the naked eye. Yeah, what I'm talking about is about the negligence of non-crisis healthcare and of mental health issues. COVID-19 has taken a toll of non-crisis healthcare due to the pre-existing shortage of skilled healthcare professionals, also mentioned by Suzanne Solis-Perez. Thank you very much. Europe needs to launch a European action plan for health work systems resilience. We see a clear role for the EU to implement objectives of the WHO Working for Health Action Plan. The EU's role should be to fund a European workforce, monitor and evaluate the workforce systems, and eventually share best practices among the member states. Lastly, we call for the visibility on invisible health issues. Surging mental health issues are among the strongest health consequences of any crisis. Beating the stigma around mental health issues and creating a mentally resilient society can be achieved by recognizing mental resilience as a key skill for employment and evaluate the socio-economic impact of poor mental health as a basis for strong investments. To sum up, our call for actions are: the HERA will present us globally and coordinate health resources across Europe, and the EU to take the lead in developing a solidarity-based workforce system and to create a mentally resilient European Union.
Thanks. Thank you very much, Leroy. I think, as you rightly explained, increased resilience is really critical to drive our health systems forward after COVID. It's however nothing if not accompanied by really a desirable health future made of equality and innovation. So our committee Vice Chair José Pérez will now tell you a bit more about our reflections on this. José, the floor is yours.
Thank you very much for the introduction, and thank you all very much for being here in presence and online. So this section of our work focused very much try to look forward and look into the future and try to address how we can tackle and how we can transform and improve healthcare system services and delivery, and on the other hand, how we can foster and incentivize the next generation of therapies that are currently being developed most specifically for, or with the biggest emphasis for high unmet needs. And in that regard, one of our biggest concerns was how we can improve the patient experience. And by the patient experiences, we can be addressing reducing waiting times, facilitating patients' referrals, enhancing communications between healthcare professionals and patients, and so forth. And for that, we've recommended on creating an EU task force for better patient experience. This task force would be focused on lean process excellences to identify best cases and practices, to assess resource allocation, and to assess disparities of care across Europe, and have these findings translated into the European semesters, country reports, and eventually into country-specific recommendations. And we are talking about improving the patient experience, but this only makes sense if they have access to basic care. And in that regard, to improve the coverage, we've emphasized the role of community-based care, most importantly for underserved populations, and we've called for the development, implementation, and evaluation of national strategies for social innovation in health, building on some of the work that the European Commission has already included, acknowledged in its European Social Economy Action Plan, and to have specific health provisions be included in future work. And we are talking about the future, and this only makes sense if we also focus on the therapies that are currently being developed. And for that, we call on making Europe a first adopter and having step up to what it should be its central role. And by that, Europe needs to update its approval pathways for the medicine of the future. And within and taking advantage of the revision of the general pharmaceutical legislation and the expansion of the mandate of the European Medicines Agency, we call on building on some of the work on the HTA revision and have a fully embedded, proactive and continuous horizon scanning of the new technologies that are being developed, having defined a centralized process for early engagement and early dialogue between EU and national regulators, as well as academia and developers, and implement accelerated review procedures, specifically or highlighting the need for this on high unmet areas such as rare diseases and AMR. And lastly, but not least, the dialogue is very frequently focused on how we can incentivize the development of new therapies, but we need also to focus or to discuss how we can incentivize their uptake and their reimbursement at the national level. Healthcare systems are not prepared for these new therapies in clinical practice, and for that we call on the creation of an European funding program at the start of EMA's approval, managed by the European Commission and be later defined in an open, inclusive dialogue, to reward member states according to their time of having a positive reimbursement decision, and have the medicine uptake, the therapy uptake at the national level.
Thank you, José. Last but not least, successful health systems, we think, must go really hand in hand with ambitious and inclusive health governance. And we must all act, as I think it has been made clear by previous distinguished guests and speakers, to preserve health from falling down again in the list of political priorities after COVID-19. It is therefore my great pleasure to introduce my colleague, Athanasios Philippou, who will describe you some of our recommendations in this respect. Thanos, the floor is yours.
Thank you very much, Norbert. Hello, everyone. I will be sharing our recommendation on future-proofing European policy action on health, about 5 key pillars of a true European health union, and how should evolve to support the new EU for Health program. First of all, we want a democratic and political anchor for EU health policy, stand-alone health committees and the European Health Parliament. Sustaining our ambitions with the EU financial committee under the current and upcoming multi-annual financial frameworks to cover the extended mandates assigned to EU health bodies, such as EMA, ECDC, HERA, etc. With the promotion of the role of the community, maintain and amplify opportunities provided to health stakeholders, civil society organizations, and citizens to contribute to the advancement of the European health. Also, it's very important, the monitoring progress. Strengthen European monitoring of national health systems through the European semester. Last but not least, it's important to share in the commitment to work together. A strong political declaration signed by the 3 main EU institutes and all EU member states. Consequently, we live in the era of accelerated innovation. Solutions aimed at serving the need to create a novel European health agora is at most important. Health policy is unique as it affects all citizens every day, therefore requiring the participation of all individuals and institutions. And as a committee, we call to revolutionize European health governance via the creation of a novel European health agora. We need to ensure the public Pan-European Health Forum should be established as a permanent and autonomous initiative, supported by a shared political and financial commitment of the EU, the WHO, European countries and regions. The Agora will be organized around an annually appointed Citizen Council, driving all of its priorities and ensuring keeping its ambition at the highest. Thank you very much.
Thank you, Thanos, and thank you all for the great presentation. So we'll be delighted to hear your feedback on our ideas and proposals, but most importantly, we really hope to work together to make future-proofed health systems a reality. Thank you.
Thank you very much for your great work for the Future Proof Committee. We will move now to the Well-being of Healthcare Workers Committee, tackling some of the most burning issues from shortages, burnout. We need to be a bit short on time. So perhaps we can ask you to watch the video we have prepared online, and then we can proceed directly only to the policy recommendations.
Yeah, good afternoon again to all of you, and thank you very much for listening to this amazing discussion. Michele, I'll leave you my seat in a short bit. So, as always, we run against time. That's the beauty of having so much content and such good content. So, a bit of improvisation. I'm here to take over from Eleonora, because Eleonora and Tomislav will have to fly to the Voxbox and have a very interesting discussion. But let me give, for the final words, the floor to Tomislav Sokol by thanking him once again for being the champion of this.
Thank you very much. First, I have to apologize. I won't be able to hear the last presentation, but because of the time delay, we have to go because we have a TV discussion on this particular topic. But I would like to thank you for giving us these great presentations. Actually, a lot of valuable ideas that we can implement here in the Parliament. And since as a member of the ENVI Committee on Public Health and Environmental Protection, but also on the Special Committee on Lessons Learned from COVID-19, I'm sure that some of these initiatives and suggestions that you provided us with, I will be able also to transfer into really concrete initiatives that we can work on here in the Parliament. Just one last point. I'm glad that these proposals, recommendations that you made are actually realistic. They are not just wishful thinking and a list of good wishes, but that this is actually something that can be done with the current competences and powers that EU has, most of it at least. Because the easiest thing is to say we have to change the treaty, etc. That's not really realistic. That we will only change the treaty only for the sake of healthcare, and some big change of treaty is also not that realistic. So we have to work with what we have, and I'm glad that here we had heard so many great proposals and recommendations of what we can do actually within the powers that EU already has. And I'll be glad to take at least some of these things that you mentioned on board within the ENVI Committee, within the COVID Committee. Thank you again very much for all the work that you've done, and I will be glad to stay in contact if you have any questions or comments on further collaboration. Any one of you, either in a group or individually, please contact my office. I will be glad to assist you. Thank you very much.
Tomislav, thank you very much again for being with us. It's hard to find in the European Parliament, but anywhere, people that really truly believe so much in this initiative. So much appreciated from us, your being here. And thank you, Leonora. Have a good TV show. Brilliant. So let me pick up. Yes, Michele, please take the floor close to Marco. You will excuse me. I was not supposed to moderate now, so we will go with the flow. That's also part of life, and that's also what makes it interesting. So now we are talking about well-being of healthcare workers with a committee that has worked on this for months. COVID-19 has shown us that really, pandemics do not know any border, but also B, that we rely so much on our healthcare workers and the ability of them to be really there for us. So I'm really happy to actually be involved in presenting this discussion. First, we have a video from Monica Gomez Castañeda, committee chair. Then we will have a couple of videos supporting the policy recommendations. And then, of course, last but not least, I will give the floor to my colleague Marco, who is the committee vice chair, and he will guide us in the discussion this afternoon. So introductory remarks, let's see if we can send them.
Thank you for being here. I'm sorry that I couldn't be there physically. I'm here to introduce the core of our work, which was to acknowledge the challenges that plague our healthcare systems and propose solutions aimed to ignite change at both the individual and organizational level to reach a systematic transformation of healthcare across Europe. COVID-19 has highlighted the structural and organizational shortages of healthcare systems across the European Union that have resulted in an unprecedented health and well-being crisis among healthcare workers. Our recommendations are a joint effort to address these challenges as a whole, where all parts that constitute the well-being of healthcare workers are interconnected and interdependent, with the end goal of reinventing, recovering, and reinvesting in the health and well-being of healthcare workers across Europe. This work is for a more unified and healthier European Union. And next, some contributions from our different stakeholders. Thank you.
Thanks a lot to Monica for introducing us to this important committee. I think exactly what she mentioned is the correct approach. We need really to discuss about these things. So before diving really deeply into what you actually are proposing to the members of the parliament to pick up and to the commission, I know we have a few pre-recorded videos from a variety of stakeholders, which I assume will present themselves. I haven't seen the video yet, so it's going to be a surprise for me as well. But just to give you a sense of who's going to speak, it's going to be members of the European Parliament, like Cyrus Engerer from Malta. There is going to be independent researchers, presidents and vice presidents of pharmaceutical associations, project officers at Eurocare. So you will get a snippet of what people think about the recommendations that these committees have. So let's see if the second videos are starting.
Hello everyone, and a big thank you for letting me address your committee on the well-being of healthcare workers as part of the European Health Parliament. This is a topic which I really have at heart as a co-chair of the Coalition for Mental Health in the European Parliament. The data is clear. Healthcare workers are simply stretched too thin and face some of the highest stress situations imaginable. Studies are showing us that 93% of healthcare workers experience stress, 86% experience anxiety, and 77% report frustration, while 76% report exhaustion and burnout, and 75% are overwhelmed and, extremely worryingly, a very high risk of suicide. Studies across the globe are showing us that more and more healthcare workers are thinking about suicide, especially during the COVID pandemic, and this couldn't be more worrying. But acknowledging this situation is not enough to make the changes needed to ensure the well-being of some of the most important workers in our society are considered. You are our essential workers. We need to break down the barriers that healthcare workers face in order to ensure that healthcare workers can get adequate access to quality mental health care without any negative consequences resulting from getting help. In the European Parliament's Mental Health Coalition, we advocate for the amplification of the voices of people with mental health challenges and for a coordinated response to address the most pressing determinants of mental health care. That is why I welcome your committee recommendations, and I look forward to learning more about your discussions today.
So I would like to highlight two important recommendations that could help improve our efforts on protecting the mental health and well-being of healthcare workers across the European region. The first one is about establishing mental health resource centers and offices within every health institution. And the second one is about systematically monitoring and also improving the working conditions and work environment for the healthcare workers. Both these efforts will not only help improve and protect the mental health and well-being of healthcare workers, but also ultimately the quality of care delivered.
The European Healthcare Student Association Summit endorses the European Health Parliament's recommendation as they are completely in line with our organization's vision for the future of the healthcare workforce. All of our organizations have been committed to better well-being of the healthcare students. Indeed, healthcare students, as part of the frontline healthcare workforce involved during the COVID-19 pandemic, are today suffering the consequences of the situation, adding to their already existing strain of their studies and work environment. As described in this policy document, we believe that space for personal development and healthy lifestyle is the most efficient way to prevent mental and physical health distress and is often overlooked. Moreover, as future healthcare professionals, healthcare students need to acquire the necessary soft skills to manage such distress for both themselves, but also for others. That also includes showing example and learning from their own experience with a more balanced work-life time. We believe these recommendations can only help students and youth become better healthcare professionals. It is today, now more than ever, the time to reinvest in healthcare youth to build the resilient workforce of tomorrow. For that matter, SS fully supports the European Health Parliament's recommendation and commits to advocate for their implementation.
Eurocarers supports in particular the sixth recommendation on the recognition of and support to informal carers and the acknowledgement of a pivotal role in the healthcare systems. We are confident that the 2022 EHP will contribute to ensuring that relevant European policies take into account informal carers' needs in a comprehensive way.
The European Health Parliament has come up with a series of recommendations again for 2022, looking towards the future. One of them involves the thing that I'm very passionate about, self-care. In this case, of course, the self-care of healthcare professionals. Providing them with a good opportunity for them to recover has been one of, or should be one of the focus areas going forward. It is a hard time being a healthcare professional these days. It will continue to be that. And I hope that we can all agree that providing a good basis for them to recover from, well, both the hard days here, but also the days ahead will be vital for the future.
Brilliant. Thank you very much to all the people that supported this great initiative. I mean, you've heard from them how much they believe in this policy recommendation. So good job to all of you for actually drafting them. Marco, I would leave it up to you from now on, keeping in mind that you have the hardest job ever, which is, since we are a little bit late, you have 9 minutes to present everything and to have all your speakers to talk. I will be brutal, unfortunately. And at 15:20, I will call my colleague Michelle Chang to the podium to talk. So, Marco, go ahead.
Thank you, Alessandro. Yeah, it appears that we're going to see my facilitation skills at the moment. So we in our committee are very thrilled about this topic. And we have been working very hard. As you can see, the name of the topic is about well-being and mental health of healthcare workers. And it is very outstanding to see all the support that we have received from different stakeholders and policymakers. And we are as well very, very thrilled to present you our work and what we have been doing so far in the past few months, as our work was structured in several pillars, as mentioned as well by Monica, who unfortunately cannot be here with us today. And it is about recovery, reinvention and reinvestment. So I'll be very happy here to hand over the baton to one of our two committee members who are here present to really dive in and kind of explain a bit more about these recommendations. And these are Paul Caulfield and as well Estefania Cordero. So pleasure, and over to you.
Thanks, Marco. Perfect, great. We're on the right slide. So thank you, Marco. Thank you, Monica. Thank you, everybody, for all of your interventions today and your recommendations. Paul and I are now going to present our committee recommendations. Next slide, please. As MEP and Gerard said it best, the research is clear. Healthcare workers are stretched way too thin and face some of the highest stress situations imaginable. The studies, like the ones behind me on the screen, highlight the conditions of stress, anxiety, frustration, burnout, overwhelm, and high risks of serious mental ill health consequences for healthcare workers. And this is what we've centered our recommendations around today. Next slide, please. Our committee has centered our recommendations around 3 themes: recover, reinvent, and reinvest. We want to emphasize that these are not sequential steps. They are intended as interconnected recommendations from a preventative perspective that can be taken at both the national and European policymaker level. in the short, medium, and long term. Next slide, please. Recover. The theme Recover focuses on the notion that a single, systematic, and coordinated EU recovery framework is necessary to recover from intense fatigue, burnout, and distress experienced by healthcare workers over the last 2 years, but not only. It aims, of course, to break down mental health care and well-being access barriers for healthcare professionals, including informal carers and also future healthcare workers. It also aims to improve and protect mental health and well-being at work through robust governance structures and ensure support offices, quality nutrition, physical health, and by implementing recovery measures, we aim to not only improve the well-being and resilience of healthcare workers, but also the quality of care for patients. Next slide, please.
Thank you, Steph. So we felt these two tweets sum up perfectly the goal of the Reinvent pillar. From the outset, we were very cognizant of the fact that the onus of responsibility for the workers' well-being is not solely put upon the individual. Our work environment are the main problem in many cases, and we need to make the organisations more resilient. We need to reinvent the work environment to break down the stigma around mental health issues and regulate the work environment to ensure a fair work-life balance and patient safety, and to ensure that the worker is respected and recognised for the care they deliver, especially our informal carers. Next slide, please. So I spotted this letter from the Victorian Premier Daniel Andrews, who sent it to his healthcare workers in Australia recently. It reads as follows: I know nothing can return everything you've given up for all of us, the split shifts, the late nights and the missed weekends. We can't give back the kids' birthdays spent at work or the holidays never taken, but we can do this. We're investing in more staff and beds, upgraded EDs and new hospitals right across the state. I know it doesn't begin to make up for the enormous sacrifice you have all made, but I hope that it shows that how much we value the incredible work that you do and how important you are to our entire state. Our Reinvest pillar is about investment revolving around the healthcare workers to improve their well-being and protect them, as they are the backbone of our healthcare systems. Next slide, please.
So, as you can see, we have a very sizable challenge before us, requiring across all levels, from universities to healthcare facility managers to national to European policymakers, to take action. Next slide, please. We've conceptualized these actions from the individual and medium scales to highlight how, at each level, decision makers can take measures that will positively impact the well-being of healthcare workers. And these proposed changes would provide support to individual care workers, as on this slide. Incremental changes like having on-site support offices for all health facilities to prevent and provide support and help to manage mental health challenges, including training programs to promote resilience and well-being. We also know, for example, that healthcare workers are more likely to follow unhealthy diets and not meet physical activity requirements, and so we propose lifestyle support interventions that are therefore needed to improve overall health. On the medium scale, important strides need to be made in tackling unlawful working hours and mechanisms to ensure work-life balance. All of these measures would crucially contribute to a wider paradigm shift in the current working culture around health and care professions. Next slide, please.
Ahead of the European Commission's planned adoption of the European Care Strategy in Q3, we called for a progressive approachment of the working conditions of the informal care sector through a quality framework to allow people to provide care for their loved ones without negative financial or social consequences. We need an EU-wide definition of who constitutes an unpaid carer. We also proposed the creation of a Wellbeing for Healthcare Workers thematic network, which can act as an instrument to improve retention and attraction of young healthcare professionals by mobilising and fostering consensus-building partnerships with stakeholders and experts to share best practices across Europe. We need to create a European Wellbeing Knowledge Hub by increasing research funding. We proposed the Next Horizon Europe calls feature a distinct facet inclusive of all healthcare workers, regardless of where they work, along with the structured funding mechanism available at a national and EU level. And finally, to coincide with the Future Proofing Committee's European Action Plan for Healthcare Workers, our committee calls on national policymakers to map out and realign the education and skills mix of their health workforce to the future healthcare needs of European citizens, rather than the past demands, to ensure that healthcare workers are at the centre of EU health policy. Next slide. So what needs to be done? Small incremental fixes can play a major part on well-being, but systemic issues are also at play. Organisation measures, policies and systemic changes proposed by the other EHP7 committees can have substantial impacts on healthcare's well-being. Political and financial commitment is also needed for Member States to tackle these issues unilaterally and collectively. And we need to move on from the heroes label in the political and media discourse. Posters and slogans calling them heroes deflect from real policy changes and genuine support. What we need are long-term investments about caring about the people who care for us.
Thank you very much to Stefania and Paul for this brilliant intervention around our recommendations. We are also very pleased to say that we are having here Michele Calabro, who is also a director within EUREGA, so European Regional and Local Health Authorities. We're very thrilled to have you here with us, and we are very happy to converse around this topic very briefly with you, because we understand that healthcare workers are the heart of our society, and it is lovely to have all these ongoing EU initiatives around European health data space, digitalization, cancer plan, trainings, but what if we do not have anyone to care about us? So very key question here is, Michele, and considering your vast experience in EU policies, how do you believe that we can set up now a proper advocacy strategy for future to come? Because, okay, we came out with these recommendations, the whole Parliament, but now what we can do to implement these better in the ongoing EU initiatives, to say so.
Yeah, thanks a lot, Marco, and thanks for the invitation and for the great work of the committee. I'll be extremely brief, so Alessandro can be as strict as possible. I think you did a great job, and the hard part comes now, indeed. The advocacy strategy has to be something that needs to be feasible. So as MEP Sokol said, it needs to be something that has to be achievable. You need to work within the already existing frameworks, the already existing funding opportunities. I think funding opportunities is a very important bit of your job. There's a lot of funding going towards upskilling workforce, skills for digital health, but the dimension that you tackle in may be a little bit overlooked. So try really to look into the projects that are looking at health workforce and skills, and try to deal with them and connect with them to tell them, hey, also the well-being is an important part, consider it. I think the other important bits for the advocacy strategy and so on, I think try to plan it as much as possible, try to work in partnership as much as possible. You already engaged some key stakeholders that I've seen in the video, so keep doing that. Find some champions. We had MEP Sokol, we have several MEPs today. They can really bring the ideas forward in the different dossier, and to yourself also be your owners of the recommendations. So try to include it in the job that you do every day. I think that's super important. And one last thing, do not forget, of course, of the regional and local and national dimension. A lot of things happen at European level, but we're talking about 17 or more member states that are looking at organization of health system at a regional level. So that's where the change can come through, and that's where you can also tap your recommendation into.
Fantastic.
Yeah. Thank you very much.
So, Marco, I'm afraid you need to turn off your mic. Super. So, Marco, Paul, Stefania, thank you very much for having presented your committee recommendations. Michele, always great to have you. You are now a long-standing friend of the EHP, so it's always great to have you back. We need to give the line to the Vox box in 4 minutes. So, Michelle, please join me, and let's let this gentleman go back to their place. Michelle, we will need to be extremely fast. You have 3 minutes, and I will keep 30 seconds at the end to close.
Should I sit here?
Please sit here,
Okay.
Close to me.
Okay, can everyone hear me? So good afternoon, everyone. And as a representative from the College of Europe, one of the founding partners of the European Health Parliament, it is really my pleasure to close out the 7th edition of EHP, which has been an important part of the education now of 7 different promotions from the College of Europe, and 3 of them are in this very room, which is really exciting for me. So the College of Europe was founded in 1949 as the first postgraduate program in EU studies, and one of the key components of the College of Europe formula is to combine academic excellence with the development of professional skills so that our graduates can integrate into the global job market. And the College of Europe participants, as well as all participants of the European Health Parliament, have developed skills in research, writing, analysis, and advocacy to produce the policy proposals that we've heard today. And moreover, you've also built up important networks that will be with you long beyond the EHP7. So I'd like to go and thank a few people, including our partners that you've already heard from, so I'll try to go and speed along ahead. I also thank the European Parliament and the EU40 for hosting us today, all of the speakers for sharing your time and knowledge with our participants. I would also like to thank those who have endorsed the EHP proposals, and that's provided a really important validation for the work of the European Health Parliament. And finally, I would like to thank and congratulate all of you, the participants of the EHP7. And while your experience of EHP7 ends today, you are always part of the EHP community. We will continue to advocate for you and your ideas, and we encourage all of you to do the same. Please know that your energy, your creativity, and your enthusiasm has inspired all of us to take action on the creation of a resilient European health policy. You should be proud of your work today because we all are. We thank you and congratulate you.
We are definitely proud of all of you. So thanks a lot, Michelle, for being here with us. So now I really would like to close. Thank all of you for being here. Thanks the member of the European Parliament for hosting us and being here. Thanks everyone behind the scenes. This was an incredible effort to bring all of you here today and have this amazing conversation. And of course, at the end of the day, to thank you for being really part of the EHP7. The work starts now. Go and advocate. We will be here to help you along the way. So with this, we can give the floor to the Vox Box. Soon enough, you will hear from Sandra Gallina, Director General of the European Commission, from Tomislav Sokol, Member of the European Parliament, and from Anka Toma, Executive Director of European Patients Forum, as well as Eleonora, the President that you have met here. The Vox Box is presented to you by our partner Euronews. So thanks a lot, and we give the line to the Vox Box.
It is summer, it is vacation time, and the pandemic seems to be everything but over. If you look around over the past weeks, more and more stories are emerging from people who were infected with COVID, family members, neighbors, co-workers. And this at a time when people are about to travel on packed airplanes and trains to go to crowded beaches and resorts. Health officials are already worried about the situation in September. What could be a better moment for a discussion named European Health Policy Recommendations for the Future? Hello and welcome to our live debate in cooperation with the European Health Parliament. I'm Stefan Grobe, and I'll have the great pleasure to talk about the health situation with four first-rate guests whose job it is to think about how to make things better. And by the way, I'm sitting in for a Euronews colleague who just got COVID a few days ago, so this is a real-time experience for all of us. But let's get started and bring in our panel. To my left, Sandra Gallina, Director General of Health and Food Safety at the European Commission from Italy.
Good afternoon.
Next to her, Tomislav Sokol, member of the EPP group here in the European Parliament from Croatia, member of the Special Committee on the COVID pandemic and member of the group MEPs Against Cancer.
Hello.
Welcome. On my left, Anca Toma, Executive Director of the European Patients Forum from Romania. And on my extreme right, so to speak, Eleonora Vartumian, President of the European Health Parliament, Board Member at the Institute of Cancer and Crisis, and a Senior Health and Policy Officer at the European Cancer Patient Coalition from Greece. Now, welcome to all of you, and thank you for joining me. What I want to do first is ask you about your sense of the current state of affairs. Is COVID under control or not? Are our health systems resilient enough? Are we prepared for new waves? And Sandra Gallina, I'd like to start with you. You are in charge of the European Commission's Health Department. What is your take on the current situation?
I would immediately say that it's under control so that people don't start panicking. However, we need to start learning to live with COVID. And this is what we have not learned yet. So for me, these days are a bit groundhog days because, you know, we had last summer the same situation. We relaxed measures and infections peaked. May I say that for as long as the vaccines do not have, as what we say in jargon, perforations, meaning that they still hold good, and for the time being this is the case, we will not have an increased pressures in hospitals, which is what also causes a chain effect on other diseases, which I hope we will touch upon, given that the Honourable Sokol is a leading light on cancer, a flagship initiative for this mandate. So for me, the situation is under control for as long as we also exert some sort of attention to the fact that COVID is amongst us. If you don't feel safe, just wear a mask in a plane. It's not an obligation, but if you feel safer with a mask, FFP2 masks, please, because, you know, other masks is not necessarily so useful. For the rest, I do believe that when you are having contact, you need to be really responsible. And stories which I heard on the press about, I would say, tennis players not declaring themselves, or criticism of those who say, I am sort of infected, I will not play, this doesn't work. So I think we all need to be responsible. If you have some symptoms, do a test, possibly a PCR test, and then participate in normal social life without being too anguished, you know. Angst about COVID will not give us good results, but responsibility and attention will.
All right. Tomislav Sokol, you're a doctor yourself, you're an expert, all matters health-related. You just heard from Sandra.
Actually, I'm a doctor of health law, so I'm a lawyer by original profession.
Okay, well, that's already something. Now, you've heard Sandra Gallina say that we have to live with COVID for a long time. Is this a matter of years? And is it 5 or 10 years? Or what is your perspective on this?
Yeah, I mean, it's hard to make predictions, and it's always dangerous to make this kind of predictions. But definitely, we have to learn to live with COVID, as was already stated. We are now in a situation that we have a new strain which is more infectious than the previous, but does not leave such severe consequences, meaning that our health systems are not so under pressure as they were before, and we have to take into account all of the factors and all of the objectives. So also the fact that we need to maintain the economy, we need to maintain value chains, supply of critical goods and materials. So I think that definitely some kind of complete closures are not an option at the moment. That is important, because if you also go too far in restrictions, we also learned part of that lesson. You can also have counter effects in terms of other diseases, mental health problems, mental health issues, delays in people getting diagnosis for non-communicable diseases such as cancer that you mentioned, but also some other things. So if we go too far in the direction of restrictions, the final consequences can be counter-effective. So we kind of have to try to learn to live with COVID, but try to balance all of these different issues that need to be taken into account.
Anka, Toma, you represent the people who are at the very center of all this, the patients. From your perspective, how do you see the development of COVID so far, and what is important for you?
I would use an emergency room type of analogy, where I would say the situation feels critical but stable, which is the first step towards improvement, right? It's been critical for a very long time, and this disease has affected our community of patients in many, many ways. Thankfully, it's stable, and it is stable because vaccines have been available, and clearly they work, that the social distancing measures have stuck. People are more careful now, so there's a personal behavior element that has been adopted. That masks clearly are helpful in preventing transmission in crowded places. So we are in a point now where we are feeling ready to live with this for a very long time. We have just had at EPF, we've just had a congress last week for 2 days in person, 150 people. What we've done, because a lot of our attendees were patients themselves, so we've ensured additional social distancing, we've recommended masks, and we've been in a situation where we did not have a super spreader event. So it's quite clear that even in the patient community, we are able to live with this, and there's from the social point of view, from the mental health point of view, it is time to go back, to go into a more social, in a social setting where we interact a bit more, and where travel restrictions are just not okay with our community anymore. We need to go into society. I wouldn't say back, but forward.
Okay. Eleonora Vartumian, you are president of the European Health Parliament, which brings a huge experience to the table. Based on your work there, how do you see things going forward? And maybe tell us about the European Health Parliament.
Yes,
absolutely. Guess that many people out there in live stream land don't know about this.
Of course. The European Health Parliament is a multidisciplinary platform. Each year we gather 60 young professionals to develop policy recommendations upon consultation with the European Commission. So we tackle some of the burning issues in Europe. This year we have topics from digitalization, prevention, sustainability, future-proofing healthcare systems, and well-being of healthcare workers. And the main aim for this year is to create a resilient European Health Union by recovering, reinventing, and reinvesting in health with a think patient, think digital, and think sustainable mindset. So this is what we are trying to achieve. I would say to absolutely follow our website and see all these young dynamic people, what we are doing right there. We're all working in healthcare. We're passionate to bring a change with the support of members of the Parliament, the Commission, and civil society, so we can create a better European Union, which is leading in this area for our generation, but also for the next ones.
All right. It has been 2 years now that we all have been living with COVID, yet we're still experiencing wave after wave of COVID, some bigger, some smaller. What are the main lessons learned for the EU, for lawmakers, pharma companies, doctors, patients? Do we learn new lessons after every wave? I want to start with Mr. Sokol here.
So I think the first lesson is that we actually need common health policy. So that that this COVID pandemic has showed us that there are some health issues which member states cannot resolve that by themselves. And I'm mentioning this because in the past we usually the excuse for not having more action on EU level was the fact that the healthcare is primarily national competence. It is, and the fact is that we didn't have a real common health policy, systematic health policy before. It was kind of always ad hoc solutions to some things which emerged, like cross-border healthcare cases and then the directive, etc. But we didn't. There was no systematic common approach on EU level. This has changed now because we now see that these big public health issues, big pandemics, cannot be resolved by member states themselves, because pandemics like this do not know and recognize borders. So we need common Europe, and this was proven in the first months. So when we didn't have common European response, we had border closures, export restrictions, lack of medical equipment, etc. So to prevent this from happening, we need more coordination. We need common European response, common European rules, what to do in these kinds of situations, common protocols, common common stockpiles of necessary equipment, and we also need a stronger institutional framework, which has already been developed by the creation of HERA, by strengthening of the mandate of the ECDC and EMA, European Medicines Agency. So this shows us that really now we have this chance and this possibility to strengthen this EU framework to be better prepared for future crises. What is important is that we don't lose the momentum, because healthcare was traditionally on the margin of the interest here in Brussels. This has changed primarily because of the pandemic, but also because of the Europe's Beating Cancer Plan, which was the initiative started in 2019 by Manfred Weber. But now we already see that this momentum is already shifting towards other issues like Fit for 55, Ukraine, war in Ukraine, obviously. So what we have to do, and this is why initiatives such as European Health Parliament are good, is to really keep the focus on health issues here in the Parliament, here in the Brussels bubble. Not just on COVID, but also on non-communicable diseases, on heart diseases, on mental health that I mentioned, because all of these people who are suffering from these diseases have suffered additionally because of COVID. We have to see what to do to help them and to develop common European strategies on actually how to better treat and better prevent these kinds of diseases. Because we cannot harmonize, we cannot unify healthcare systems on EU level. We cannot, because funding and organization, financing of healthcare systems, definition of health insurance packages is a member state prerogative, but still we can do a lot to actually help member states and support their actions to resolve problems which exist also on the national level. And also one thing which is very important is to use whatever we can in the EU, from the EU budget, EU for Health program, cohesion policy, recovery and resilience facility, to try to mitigate the differences which exist in terms of the standards of healthcare provision in different member states. So there are much bigger chances of you dying from cancer once you're diagnosed if you live in certain regions of the eastern part of the EU than if you live in Belgium or the Netherlands, for instance. So this is something which is unacceptable. This is why we have to actually work, and I was a rapporteur in the Committee on Regional Development on how to use EU funding to relieve these differences. So we also have to work additionally so that there are no first and second class citizens, but that all citizens of the EU have at least similar standards of healthcare provision.
All right. Anka Toma, lessons learned for patients and doctors, what are they?
I think the most important lesson for our community was for our community or for society with respect to patients is it really brought the spotlight onto the vulnerable people, the people most affected by this pandemic. So you had the people who had worse severity of disease because they had comorbidities. You had people at higher risk because of various inequalities in society, health inequalities, socioeconomic inequalities. And then you also had the clear society inequalities that have to do with vaccination, vaccine hesitancy, and a lot of these also highlighted some of the pre-existing challenges in health. So from purely the patient's perspective, I think highlighting the vulnerability of people was very, very important. The second thing that we saw was that health systems that were already fragile, they really buckled under the pressure, and our community reported to us delays in access to care, delays in access to diagnosis. I mean, these I hope they are already known, and if they are not, there were huge delays for a lot of our patients. So there were a lot of indirect suffering, illness, death that were caused by the fact that people weren't diagnosed, that they didn't have access to health professionals because health professionals were suffering with the crisis. So that in turn is the opportunity to rebuild, to build back better. What everyone says, we need to rebuild the health systems in a way where equity of access is a fact, not an aspiration. We need to build that. So from our perspective, what's really good is that there's finally health at the top of the agenda. Yes, there's a lot of other important things, but health is really important. That together is better, and that finally health is being resourced a little bit closer to what it should be. I'd still say more, but you know, we are coming from a health program where every penny was counted, where we were looking for bits and bobs everywhere to fund health initiatives. And now health also has a budget, which is just, it's amazing, it's incredible, and it's right.
Eleonora Lacuna, you were nodding several times.
Absolutely.
Now you're at the Health Parliament. You're thinking about solutions, and obviously this needs to be done after having recognized the lessons or detected the lessons. So, can you speak to that?
Yes, I think when the COVID-19 pandemic happened, we were not prepared as we would have because we didn't have a lot of information about the new disease. I would say it also takes a lot of time to educate the population about to follow sanitary measures, to listen to the authorities. So what I can see right now is we see an increase on digital tools. So we can see that self-care is prioritized. We can see healthcare workers investing more in digital skills. So we can say that the digital transformation is actually happening right now. And this wouldn't be possible without this experience that we have gained. And we can leverage on that because Europe has so much to offer in this area. NCDs as well, MEP Sokol said, they caught a bitter attention because people were not having access to primary care because they were actually neglected in the hospitals because of in one night the hospital became like emergency rooms because of all these many cases. So what I would say that we have increased definitely cross-border collaboration. The European Commission has done a great job, especially with negotiating in terms of access to vaccines and for the member states. So in this way we can see how EU member states and at the EU level, how we can support national members to make decisions and actually improve the policies that we have in place.
And Sandra Galina, the question about lessons learned, we've heard that question many, many times. And yet we're still going through wave after wave after wave. Do we learn particular lessons after every wave?
Of course. Human beings always learn lessons. I would say that under the leadership of the President and also the Commissioner, what we have seen is that the vigilance is never enough. And so the first lesson after every wave is that perhaps a bit of more vigilance can be helpful. Second thing that I would like to say is that what we have learned in these successive waves is that, of course, without health, there isn't a social life, there isn't an economic life, so health comes first. But beyond the words, we want to see now the facts. The European Commission has been helping member states in putting the priorities right when it comes to the RRF. So these funds, the Recovery and Resilience funds, should help to boost the public health systems in their fundamentals. So if you allow me, we have, from the first waves, we have learned how to be prepared against the emergency, but now we need to go beyond that, transition out of the emergency and build resilient public health systems. Now, to arrive there, it will take a bit of time. It will take also a bit of investment from, I would say, the top, from prime ministers, from the heads of state and government, because let me say, what is clear is that the pressure of many other emergencies which are equally disastrous, like the Russian aggression on Ukraine and all of this. It's not that, you know, they take their space because they are so huge, but health is still a priority in the minds of leaders. I can see it from the president. My commissioner is attending every G7, and you know, I can see that there is in G7 and in G20 a huge attention to this. What is impossible humanly is to have all priorities at the same time. So let me say, what we need to watch is that the health priority does not slip. So I count on the politicians, you know, I'm just an official, I count on the politicians to keep health very prominent on the agenda, because the investments for, I repeat, the long term, the sustainability of public health systems, and here a word for the workforce. Patients suffer because, let me say, not only structures or investment is not at the right level, but also because the workforce needs to be trained, recognized, and rewarded. You know, the disparity in terms of salaries of the health workforce in Europe is there. It's, as Honorable Sokol said, this is a national competence, but, you know, at the same time, we are all human beings, and there should be a bit more equity. So for the long term, I sense that health is a field where disparities will no longer be tolerated by patients, but also by the people who work in this sector. And I think that industry has also come a long way. It's a lesson that they learned is that, you know, a market of many millions of people will also want to be treated as a single market, because we have seen, and I hope in the pharma strategy in the future to address this issue, that not all medicines are available everywhere, and this is something that should sort of change. Let's hope.
I want to bring up one point that was very important for people during the pandemic, the impact of the pandemic on other disease areas.
Oh, yes.
Screenings, surgery, treatment. What was that impact? Are there any data that suggests a major problem in particular fields? And do you have any examples, Eleonora?
I can speak about cancer, the statistics that we have. Of course, we have to invest a lot with healthier lifestyles. So when it comes to access to nutritious food and when it comes to tobacco and alcohol control, we would see some countries have higher risks when it comes to alcohol consumption, and some of them are on tobacco control. So this is exactly where we need to step in and make some interventions to help that. The situation is deteriorating, unfortunately, especially...
It still is.
It still is, and we expect to even grow these numbers because a lot of cases went undiagnosed because these people were not, they postponed the treatments and the screenings. So right now, this is exactly what needs to be done to prioritize these disease areas. I'm glad that the European Commission has cancer top on the priority. It's one of the biggest issues we have in Europe, with many incidents to increasing. And I believe that if we invest in this sector, and also civil society, patient organization, let's work with our national society so we can implement what the European Commission delivered to make it implemented and actionable in our member states.
Anka.
Oh, let me show you, because what we've done is we have surveyed our members. So EPF has now 78 members across the entire European region. And a couple of years ago, we've asked them, how has the pandemic affected you? So let me tell you what they said, because it's really alarming. 95 of our respondents, which is patients across Europe, have had some kind of challenge. So basically, almost everyone had some kind of challenge. Most of them reported stress and anxiety. Also, most of them reported social isolation, treatment delay in 50% of patients, or discontinuation. People who were under treatment who stopped. About 1 in 8 stopped their treatment. So there you go. Information and communication from national authorities were less than perfect for a good third of our respondents. There was an impact on employment. So patients were affected in many ways. Some are very distressing. And I would say, and we are going to repeat this survey this year, so 2 years on, we're going to ask them again to see how it evolves. But from what I perceive, mental health impact is something that we really need to focus on. We really need to look at because there is a collective trauma from this.
Tomislav Sokol, you've heard this. The situation is apparently not getting better, at least immediately. What are your observations here? You're particularly interested in cancer.
Yes, but it's not just cancer. For instance, I've had a lot of discussions with people suffering from other non-communicable diseases, for instance, from heart diseases, but also from other types. Also on mental health, we had a lot of discussions and a lot of events also on the impact of the pandemic on mental health, and the situation is definitely not good. I think it is, at least in my country, I can say that now it's better. At least now the health system is kind of picked up some of its regular activities. So in that sense, there are no new delays, but we have a big backlog that we have to fight from the last couple of years. And of course, we don't know exactly what will happen in autumn. So we have to be prepared on that. So this is a big problem, but this has highlighted the structural problems that health systems, national health systems, definitely suffer from. And I think that equity is here one of those crucial issues and one of those crucial dimensions where EU can provide this added value. For instance, when we speak of workforce, of course, we speak a lot about investing into infrastructure, equipment, etc. But without investments into workforce, there will not be a result. Especially, we have to improve working conditions for them, create retention strategies, because this problem of brain drain, especially in some areas of Europe, is really dire. And I know from my country, the biggest problem, of course, was, I think it's most of these countries, in the first couple of years after they joined the EU, not so much after that, but there is still a continuous emigration of health professionals, especially doctors, in some specializations, but also nurses. I think that also we do not discuss a lot of the problem of the lack of nurses, which in some countries is even bigger than the lack of medical doctors. So we definitely need to use European Union more. So we need to use the cohesion policy more. The cohesion policy, which is the aim of which is to reduce differences in terms of levels of economic development and living standards across the EU. We need to invest both into infrastructure through ERDF, for instance, European Regional Development Fund, but also to use European Social Fund more to fund the new specializations, subspecialization, specializations, university programs for higher education in medical professions, because this is the only way to relieve these problems which exist. But definitely, what is important is that we have a continuous European action, which also means that we create permanent structures, permanent budgetary sources of budgetary funding, primary permanent institutions, new institutions like new agencies, strengthening the existing agencies. If we want to have this, if we want to maintain the focus and to have this continuation of European action in the area of healthcare. EU for Health program is one good example. It's 12 times bigger than the previous budgetary program for health in the previous budgetary period. It's not as big as we wanted in the Parliament. So we wanted more than 9 billion euros. Now it's 5.3 billion euros. It was a compromise, but this is definitely way forward, and we have to continue that direction.
Are European health systems prepared for the next pandemic? And what need to be improved? Sandra Galina.
Oh, a very challenging question. So let me say, in a nutshell, they are getting prepared. So I would like to underline what was said at the end by Honourable Sokol. It's the long term and the sustainability in the long term that is the challenge. Because what I saw is that there is the 100 flowers, as I call it. After COVID, there have been many laudable initiatives to give a sort of response. And I would say that the big boost that we had in digital was part of that. Now, this needs to come out from an ad hoc sort of approach and needs to become something more stable. So some member states are better than others in giving sustainability and long term, so that the waves of COVID will come. As I said earlier, we need vigilance, responsibility, we need to live with COVID. But at the same time, our systems need to be resilient for other diseases. I mean, we cannot leave the non-communicable diseases behind. Let me say to all of you, this year, I would commend the read of a yearly publication that we have with OECD. It's called Health at a Glance. You will have absolutely all the figures, so I would not be able to tell you how long the delay was, I would say, because we are still waiting for the data of 20 and 21. So this year we will collect them in the publication, and we will see. For some member states, we are in really a matter of the backlog not being, for 2020, not being disposed today. So this is where Europe comes in, and I would say there is a variety of funds, from cohesion to social fund to the EU for health, all have been just mentioned. But let me say what I see is that we need to avoid a duplication of easy actions in the things that, may I say very crudely, get votes soon. So for instance, it is clear that opening hospitals, giving more machines, makes people feel safer, but what would really be helpful is prevention, prevention, prevention. I will insist. This is why in cancer we will add new screenings, as screenings that are more or less mandatory, because health is not the state of absence of diseases, is your normal state. So people need to come to the conclusion that there are health determinants, from tobacco to alcohol, to, I would say, movement and nutrition. Movement, physical movement during COVID was quite difficult. So in the long term, if we have to live with COVID, even a small aspect such as how are people keeping up with their mobility in terms of movement, elderly, young people, it's an aspect that member states need to cater for. So I think they're getting prepared. There is a willingness. I repeat, I think all leaders are aware that health is a priority, but other priorities are eating a bit of the space. But I am an optimist, and the money is there and the will is there. It takes a bit of also work to put the programs together.
When I think of preparedness, I think of vaccinations.
Of course.
Now, we've seen a big problem with vaccine hesitancy, and there is a sizable part of the population that refuses, for whatever reasons, to get vaccinated. How can we as society deal with that, Eleonora?
One of the biggest challenges is actually the fake news that were ongoing. We would have people even questioning if the COVID-19 pandemic existed or not. So I would say Europe has to have a better control over what is circulating right there. Again, as I said before, it was also about the misinformation that we had, like COVID is transmitted in closed areas, in open areas. I would say that we weren't coordinated in this. And when you have this misleading information, of course, this creates hesitancy to the general population. So what I would say in this case, we need to create trust to the public when it comes to vaccines. It also has to do explaining the added value of this, because I felt like we said you should get vaccinated, but we never elaborated on why. So things that are so simple, taking into consideration also the different inequalities in member states and different educational level, we need to reach to these people and explain to them. So it has to do with a lot of cultural transformation, creating trust, open communication and collaboration within EU member states. We have the commitment, as you mentioned correctly. We have the finances. Let's sit together and I think that everybody now wants to sit around the table and talk about the creation of European Health Union. Now is the momentum to build on this hesitancy, and then we can progress all of us together.
I want to talk about the European health data space, something that was launched before COVID, but has certainly accelerated. What is it exactly, and what benefits can people get from it? Patients, nonetheless. Anka Thomas.
You're starting with me. It is a Commission initiative, so I'm pretty sure Ms. Galina is going to have a lot more to say about it. It was about time. In short, it was about time, and we have seen the pandemic accelerate the digital transformation of healthcare. We have been, as a community, looking at this very closely. We very much welcome the proposal of the European Health Data Space, and we will be very happy to work to support the Commission in the next steps, which are going to be not easy and not straightforward as any legislative process. We have seen that the proposal for the health data space is built around patient needs, which are access, privacy, protection, but also a fundamental objective to advance health research, to advance innovation, which are things that our community needs. Really good developments. We would like to see a little bit more patient centricity in it. We'd like to be involved in a bit more of a structural way in how it's run. But I'm sure that is something that we will have plenty of time to talk about. So good news in that, and it's really.
I think that San Ragini likes to hear that.
Oh, I love it.
What are the benefits for the, and what are the critical points where it's not yet?
Oh, yes. So, first of all, data sharing saves lives. This is important. You bear in mind that we are sitting on a pile of data that can be extremely helpful. You can have that by experience yourself. When you have an ailment, what do? You first start with a small talk with a friend, and that is already something interesting. But I would like to say that it is extremely important that we realize that health data are very sensitive, are more sensitive than even normal data. So there is this first element that we need to bear in mind, that we need to do this in a securitized environment and in an environment where there is trust. And it was a good omen you started with patients, because the real aspiration I have is that at the center of this proposal there is the patient. We're not China, we're not the US, we will be Europe. We have the GDPR, but this is, I would say, an area which is even more important for the citizen, because it's about your health data. So you need to be empowered at any time to be able to say, I want my data to be used or not. At the same time, the challenge is that we need to have small researchers enabled in their research, because what we have at the moment is that perhaps bigger boys have the ability to have the data, but the smaller ones, the small university researchers, we are talking here in jargon, they say secondary use. Secondary means after the hospital, let's simplify, where your doctors are looking at your data, the second gaze of the data, who is allowed to have it. So this is going to be an area of huge discussions, but I can sense that the time is ripe now for, I would say, a very mature approach to how to share the data. I think that at the end of the day, we have, I would say, an overall expectation that this health data space will be at around 1 billion in terms of cost for the EU. We have a budget. The real art will be to somehow have member states relax, because all of them come to me and say, I have my digital thing. I'm not going, look at the digital pass, I'm not going to change your system. What I want is interconnection. First of all, I want a smart card, if we can call it like that. A patient needs to have its own record here in its pocket, go everywhere in Europe, get the same medicines. So it's about a bit the roaming of health. Think it about more the roaming of health. And then, try to finance, from our point of view, these connections, which, of course, the member state with the RRF will do the work inside the country, but the RRF does not provide for the final mile between the member states.
If I may interject here briefly, I think the main issue that people have with this, or the main thought is, can I trust that my data will be protected? Do I put data out there and everybody has access to it?
No, exactly.
What do you say?
That is not the idea. Let me say to you, the platform that we are talking, I would say internally, is something a bit visionary, in the sense that, of course, there will be a certain level that can access these data, and it will be a level that will be established in conjunction with the discussion with the Parliament and the Member States, because here we need to see who is actually a person who can or should have access to your data. But let me say, the most important point of this platform will be the centrality of the patient. You will be able at any time to access a platform which will show where your data of that certain disease or period in hospital, it can be any sort of part of your health life, or let's say non-health life, and is used by whom, or is, at the same time, we need to understand that having a very cumbersome system where the patient needs to actively somehow allow this is going to be particularly cumbersome to manage. So be trustful that the data you will access who can, and you can stop that. You need to be able to say, my data will not be used by that. Imagine you have a particular specific phobia about a certain thing. You say, my data, I don't want them to be used there.
This system is a great transition to my last question and the final round. And I want you to be precise and short and thoughtful. The pandemic has shown that Europe has become a much stronger health player than it was before. Is this going to continue? And what needs to be done? Is it desirable? What are your thoughts on that, Eleonora?
Yes, I absolutely agree with this statement. I think we are experiencing right now the great resignation. And what we observed is that if member states need to tackle even issues of mobility of the workforce. So for that, right now, we can see that EU member states collaborate closely together, which is a great sign about the future. And then we can see that when Europe acts together, we can have better results. Member states, by their own, they cannot act, and this is how also we can bridge the inequalities that we have, especially when it comes to central or southern part of Europe. They need support in certain areas. And this comes from workforce issues, from access to digital tools, for education training. There are so many areas that some countries are a bit behind, I would say. And if we collaborate together with the support of members of the European Parliament, the Commission, and civil society, then we can progress into the creation of a real European health union.
Great. Let's throw it to the sole member of parliament at the table.
Thank you very much. But
Tomislav.
first, I would like to comment because I didn't have the chance on health data space. I think that's definitely the most important piece of legislation, concrete legislation, that the Commission will come up with in this mandate before 2024. So I think it's very important because currently the problem with data is that in different member states we have different standards, different protocols, different ways of interpreting GDPR, and all of this is creating problems and obstacles why we cannot use this data in cross-border settings. So we cannot exchange data, which means that we cannot, and it's harder to conduct cross-border clinical studies. It's harder to have European reference networks, cross-border reference networks functioning. So all of this potential cannot be realized because of the lack of interoperability of data. This is the primary reason why we need this health data space regulation. I have to say, unfortunately, in the Parliament, we still cannot agree on which committee will be the lead committee on that. I think it should be the Committee on Public Health, the ENVI committee, which I'm a member of, but we still cannot get the agreement on that. And because of this, unfortunately, I think that the decision-making process within the Parliament will get a bit delayed, I have to say, but it is as it is. But I think it's very important, and I think that I hope that we will be able to resolve this as soon as possible. When we speak of European Union role in healthcare, definitely it has increased. It has become much more important than it was before. Now we actually have contours of a real common European health policy, so systemic solutions. We have the pharmaceutical strategy, the Europe's Beating Cancer Plan, the EU for Health program, the RRF, where healthcare is one of the priorities. We have healthcare as one of the priorities within the New Horizon, which is very important for research and innovation, that fundamental research which must be funded by public purse because there is no commercial interest in that, but which is the basis for all subsequent research and everything that comes after that. So definitely there is a lot of things that are being worked on at the moment, health data space as well, revision of pharmaceutical legislation. Also, one thing that we didn't mention, which I think is also important, is to strengthen the EU framework on cross-border healthcare, because the current system, we have two different sets of rules which regulate the same thing. It's very unclear, very non-transparent for patients. You need to be health law experts to actually know what your rights are to get healthcare in other member state if you cannot get adequate healthcare at home. And this is something that definitely needs to be strengthened and made much more simplified for patients. And I think the Commission has made a revision of this cross-border healthcare legal framework very recently. What they come up with, I think I have to say, we cannot agree on everything. I think that they should be a bit more ambitious than what they are mentioning there. I think that we need to unify the rules on reimbursement of this cross-border healthcare. So instead of having two sets of rules, to have one clear set of procedural and reimbursement rules for this cross-border healthcare, so that patients who cannot get adequate treatment in their own member state can get it in any other member state of the EU. So I think in general there is still a lot of the road to go through, but definitely a lot of improvements have been made. We have to maintain this focus on healthcare as one of the priorities, and I think that these kinds of events like European Health Parliament and these kinds of interviews and these kinds of media campaigns are really helpful for that.
That's nice to hear. Anka Toma, Europe as a health player, is that beneficial for patients?
Is that the rhetorical question? Because of course, and I was taking some notes now, thinking back of your question. Yes, Europe is a global health player, and it's probably a leader in health. And that is because of the good news that are coming out from this pandemic. We have reached a point where the conditions are really favorable, like really favorable for three things that can make it happen. One is the realization that multi-stakeholder cooperation is the way to get things done. The second one is the patient centricity of policies that are now being developed, and we recognize these intentions, and we're ready to work with the European Parliament, with the Commission, with the Member States to make sure that that actually reflects the needs of the patient community. But let's just make a little disclaimer here and say, when it comes to health data, everyone is a patient because everyone has health data. So we're not talking about the 150 million patients with various chronic diseases, rare diseases that we represent. We talk about all the citizens of the EU. I'm going to close that parenthesis. And the third good news is the digital transformation. So yes,
right.
health player, leader in access, leader in outcomes. This is what we want to see.
Okay. We're running out of time, but Sandra Gallina, one short comment on you. Obviously, you must be happy hearing this.
I'm very happy. I would like to say, yes, we are a big player. By necessity, we became a big player, which is a very sad story. We could have been a big player earlier because we had universal health coverage, which others don't have. So we are strong. We have a pharmaceutical industry that can, give you all the medicines you want. We have, I would say, hospitals that in the ERNs, the European reference networks, sort of put out advice on the rarest of diseases. I'm sometimes surprised. So we have it all. We have the political will. I think that Ursula von der Leyen put her stamp on this mandate with health. Health is at the core of this mandate. Whether we liked it or not, we are in and we will continue to be leaders.
All right. And on that optimistic note, thank you very much for watching us out there in live streamland. Thank you to all the panelists. It was a very interesting discussion, and I think we've learned here and there some things. Thanks again for the European Parliament for hosting us, and goodbye.